faster. But if you're looking at me with a heart of doubt, don't kiss me right now. Don't tell me that you need me. Don't show up at my house. All caught up in your feelings. Don't run me round and round. Don't fill me up just to let me down. Just to let me down. Don't mess with my head. Don't tell me you're falling. Leave your feet on the ledge. I'm all out of breath. Baby, don't run me round and round. Don't kiss me, no, don't kiss me right now. On your lips, just leave it if you don't mean it. Almost never leave the house. You mean it. Say it now, friends go out. You mean it. Why you never first come out your mouth? You mean it. You're staring at me with a heart of doubt. Don't ask me right now. Don't tell me that you need me. Don't show up at my house. Oh God, it's not like me. Round and round. Don't build me up just to let me down. Just to let me down. Mess with my head. Don't tell me if I'm giving you feelings. On the ledge, I'm all out of breath. Baby, don't let me round and round. Don't kiss me, no, don't kiss me right now. Let's just leave it if you don't mean it.
Good morning, everyone. Are we ready? Anyone from the group?
Good morning, Ma'am Gail.
Good morning, sir.
Yes po.
Okay. So I guess everyone is already excited. We shall proceed and start our program. A summer aloha morning to everyone. For the past days, we are experiencing a really hot. My apology for a while. Okay, let me redo it again. Okay. A summer aloha morning to everyone. For the past days, we are experiencing a really hot weather. Recently, the heat index reached to 53 degrees Celsius, the highest so far recorded. Thus, we advise everyone to please drink lots or even gallons of water today. All right. To our superintendent, Ma'am Lourdes D. Servito, to our assistant superintendent, Mr. Justado I. Kayabyab, to our CID chief,
Open kayo paano nani?
Fridas, to our SDO chief, Mr. Villamar Q. Gloria, to our administrative officer, Mr. Nelson V. Peralta, to all our EPSS, PSDSS, and respective division unit heads, to all school heads, assistant school heads, head teachers, master teachers, teaching and non-teaching personnel, and to all individuals who are with us today virtually. Again, a summer aloha morning to all. And as always, we wish everyone is safe and in good health condition. It's been more than a year now that we are in this pandemic situation. Amidst all, we are still praying and expecting uncertainty that it will resume to near normal, or what we call the new normal. We are gathered today for a VACC2 or VACC2 school vaccination campaign, where we shall now be in-depthly informed on the COVID-19 vaccines and the government's vaccination program. Discussion will focus on the objectives of the campaign, different brands of COVID-19 vaccines, prioritization level, and other related matters. A chance to be enlightened with the information and maybe help us be ready to be vaccinated. If so, we now ask ourselves, what should we do next? Thus, let's leave the worst behind and go for it. As they say, there's no harm in doing or trying it if it's for the common good. So without further ado, we shall pay respect and sing our national anthem and pray solemnly aided with AVPs. Sir Roldan?
Bayang magiliw, kalas na silanganan, alam ng puso, sa dibdib mo'y buhay. Lupang hinirang, tuyag ka ng magiting, sa manlulubi, di ka pasisigil, sa dagat at bulok, sa simayan, sa langit mo mahal, malilag ang tula at awit sa paglayang minamahal. Ang isla ng watawat mo'y tabu, may nanagniligid, ang bituing at araw na kailan, pang may magdidinig. Lupa ng araw na'y walhating pagsinta, buhay ay langit sa piling mo. Aming higaya na may mga api, ang mamatay ng dahil sa'yo.
There you have it, guys. So before we proceed, please again, to all our school heads, please encourage our teaching and non-teaching to please watch on our YouTube channel. That is the SDO SCCP TV YouTube channel. And again, as we now start our program, may I remind again to please turn off or mute our microphone, or maybe turn on your camera throughout the virtual meeting unless otherwise. And then let's avoid scrolling the mouse anywhere in the screen to avoid interruption of the speaker of the or the presentation. And any clarification, kindly write it down through our message chat box, or click the hands up button. Okay. To give us a pleasant welcome message, may I call our charming Assistant Schools Division Superintendent, Mr. Diosdado I. Cayabyab. Sir?
Hello, good morning. Thank you, Gail.
Yes, aloha, sir. You may take the floor.
Aloha morning to everyone. To our most esteemed Schools Division Superintendent, Madam Lourdes Di Servito, to the two chiefs of our functional division, Sir Marlon, Sir Amor Gloria, and Ma'am Edith Prides.
Hello, sir. Good morning po.
And of course, special mention to our education program supervisor, Sir Marlon Icol. And of course, Ma'am Glenda Doria, our senior education program supervisor, charged
Hello,
for school monitoring. To our invited speaker this morning, our medical officer 4 of Region 1, Dr. Romary Joy S. Castillo. And of course, to our very own medical officer 3 of the division, Dr. Urbano Benitez. I would like to mention also, acknowledge Sir Nelson Peralta, our admin officer. Our school heads.
Barangay Pintar. Sampikat ka naman.
Hindi pala ako nakikita.
Alisin ko na lang yung
sige, alisin mo na lang. Sandali lang kasi inaayos ni Sir Roldan ang aking monitor.
You can open your com ASDS.
Yes, ma'am. Yeah, inaayos sandali.
Makita yung wapito ASDS.
Wala palang monitor. Okay. Anyway, I would like to acknowledge also the different participants, our teaching and non-teaching personnel. Okay. Nabanggit ko na ba ang mga school heads natin? Okay. Our school heads and other participants joining us this morning. A pleasant morning, aloha morning to everyone. Welcome to this orientation on the vaccination program of our government. You know, my dear friends, vaccination is one of the steps or one of the ways in which perhaps we can go back to our known normal before. Gusto nyo bang bumalik na tayo sa dating kinaroonan natin, yung new normal, the way we used to before? So, let us campaign for this vaccination program of our government. Okay. Thanks for the efforts of our national government as well as our local government units in ensuring that vaccines are available for all Filipino people. So, as our part, ang part din natin, our contribution to this effort, of course, we have to subject ourselves to be inoculated. Are you willing to be inoculated? Are you willing to be vaccinated? Of course, we cannot force everyone. But what I would like to say is that it is our moral. Okay? It is our moral as well as social obligation. I would like to emphasize that moral obligation to be vaccinated. Kasi tayo yung nandito sa posisyon, tayo yung nandito sa gobyerno, dapat tayo ang manguna, pakita natin sa mga tao na dapat mabakunahan ang lahat so that we will be protected. Okay? So, while we have the vaccines, we should not forget to still practice and observe the health protocols. Kasi hindi lahat ng mga tao naman ay mababaksinate. So we still have to observe proper health protocols as we go on with our daily lives. Ayan. So, let us be the first to disseminate, therefore, this vaccination program of our government to everyone. Okay. Let us encourage everyone to be vaccinated so that society.
Hello, ma'am. Good morning. Ma'am,
Protected. So let's campaign for the vaccination efforts of the government. Let us be one in campaigning these efforts. So, #vaccination. Ganito po. Nakikita ba ako?
anong basis ang hinahanap nila? Is it legal basis na?
Okay. Kasi may symbol sana yung vaccinate yung sa balikat, tapos ilalagay natin yung dalawang finger natin. So that should be our tagline sana or hashtag, okay? So #vaccination. So let's campaign for the vaccination program of our government. Okay? So with that, I would like to welcome everyone to this orientation so that we will be updated, we will be keep posted on how this vaccination program will go about in our DepEd San Carlos City. So thank you very much, and let's all listen to the inputs coming from our experts so that, again, all of us will be knowledgeable, and of course we can conduct proper information dissemination and campaign about this vaccination program. So thank you, and once again, welcome to this program. Pasensya na, hindi ako nakita.
Kita kayo, sir.
Nakikita na ba ako?
Naka-off yung ito kasi.
Naka-off yung camera ko. Sayang. Okay. Anyway, nakita na ako rin. Okay? Thank you very much once again.
Yung ko lang nakita is this. Nasaan na yung bakuna hashtag?
Ito, hashtag bakuna. Okay. Yan. So, dapat yan ang hashtag natin. Okay. Yan.
Thank you.
So, hashtag bakuna. I-campaign natin lahat ito. Okay? Okay? Thank you. Naka-off pala ito. Nagalaw. Okay.
Naka-mute ka, Ma'am Gail.
Oh, I'm sorry about that. Again, thank you so much to our Assistant Schools Division Superintendent, Mr. Gisdale Aycayabyab. And again, hashtag magpabakutan na po tayo. For the presentation of participants, may I call our talented Education Program Supervisor of SGOD, Mr. Marlon B. Econ. Mr. Marlon?
Hello, Gail.
Yes, good morning, sir. You may take away floor. You may take the floor away. I'm sorry about this. You may take the floor, sir.
Nawala.
Sir Marlon, naka-mute ka.
Yes po. Ayun. Allow me to greet everyone, to the very eloquent Schools Division Superintendent, Dr. Lourdes D. Servito, the very smart Assistant Schools Division Superintendent, Sir Jusdado I. Cayabyab, highly equipped chiefs of the Curriculum Implementation Division and School Governance and Operation Division, Dr. Edita Pridas, Sir Amor Gloria, our Admin Officer 5, Sir Nerson Peralta, our Dastrius PSDSS, EPSS, unit heads, non-teaching personnel, and to all the CEOs of the different schools of San Carlos City Division, our resources speaker, Dr. Rosemary Joy Castillo, and also Dr. Urbano Benitez Jr., our very own. And to all of us, good morning everyone. Today is May 20 and 2 months to go po mga kaibigan. We're about to close the school year 2020-2021, this pandemic school year. And thank God, because despite the challenges of this prevailing situation, we are in a condition of having a sound mind and a sound body. We are physically fit and sane. And so as I mentioned your name, kindly say hello, kindly say hi, or you can open your camera and wave your hand, show the community that we are grateful for this wonderful day, okay? So, Ma'am Gail, kindly share the screen for the attendance checking. Thank you.
Can you see it right now, sir?
Baka nasa...
Not yet.
Not yet pa, nasa linya pa, pumapasok pa lang.
There, sir. Can you see it?
Not yet.
I can see it now.
Okay.
Okay, ma'am. Okay na, ma'am. Malinaw. District 1A.
So Marlon, can you see the slides? They can already see
Yes. Oh. So let's now start. Let's now start for Balayong Elementary School. The principal, Rebecca de la Cruz Gutierrez.
Good morning po sa lahat. Good morning, Ma'am Lourdes. Good morning, Sir Marlon, Sir Jusdado. Good morning po sa lahat.
Salamat po. From Bulingit Elementary School, we have Ma'am Emilita Peralta.
Morning po sa inyong lahat.
Central Wall Elementary School, Sir Esmeraldo Canilang.
Good morning po, sir. Good morning, everyone. I'm representing Sir Dong as of the moment, sir, ma'am.
From Don Vicente Elementary School, we have Juan Roselio Cristobal.
Good morning po. Good morning to everyone.
Duyong Elementary School, Ma'am Mary Grace Arenas Flores. Hello po.
Morning po.
From Julian
Morning.
Valerio Resuello Elementary School, we have Josephine Sinlao Aquino. Ma'am, good morning.
Morning, sir. Good morning, Ma'am Lourdes, Ma'am Sardado. Good morning
From
sa lahat.
Dilintab Elementary School, Ma'am Catherine Takaba Duyawet. Pagal Elementary School, we have Ma'am Mary Jane Katunggal. Good morning, ma'am.
Good morning po. Good morning po sa lahat. Good morning, ma'am. Ma'am Lourdes.
Okay, let's proceed to District 1B. Kalumpuyan Elementary School, Maria Melinda Lacunsay Rabe. Good morning, ma'am.
Good morning po, sir. Good morning po sa lahat.
Nagilayan Elementary School, Reynaldo Diaz Harillo, ma'am. Sir?
The screen is not moving.
Malaming Elementary School, Jerry Muhunhardin Kabuang. Panggalangan Elementary School.
Good morning po sa inyong lahat. God bless everyone.
Ma'am Crescencio Imos. Pangpang Elementary School, Sir Voltaire Bautista Permin.
Sir, for a while po. Ma'am is already in the next slide po.
Oh, nasa 1B na po tayo.
District 1B?
Yes, ma'am.
Yes, ma'am.
There might be a delay on your part po.
Yeah.
From Palayaw Elementary School, we have Ma'am Marites Bautista Peralta. Ma'am, good morning. From Quintong Elementary School, Ma'am Marites Diola Aquino. Good morning po.
Magandang umaga po sa inyong lahat.
Hi, ma'am.
Ma'am.
From
Yes.
Tandok Elementary School, Sir Gerardo Sapra Doria. Good morning, sir. Now let's proceed to District 2A. Central 2 Elementary School, Sir Ma'am Adelmira Maligdo Mendoza. Good morning po.
Good morning po sa lahat.
From Jose Macampaning Batan Senior Elementary School, good morning, Sir Carlito Bandang. Good morning. From
Morning po sa lahat. Morning, ma'am, sir.
Malacanang Elementary School, we have Sir Fernando Morales Torrio Jr. Good morning, sir. From Agdao Integrated School, Sir Jerry Castillo de Guzman. Good morning, sir.
Good morning, sir.
From Polo Elementary School, good morning, Sir Joel Saparilla Basto.
Hello, good morning po sa lahat.
Good morning, sir. Let's
morning.
proceed to District 2B. Ano Elementary School, good morning, Ma'am Edna Carino Roque.
Hello po. Good morning po sa lahat.
Uliling Elementary School, good morning po, Ma'am Arlene Hermojeno Sabangan. From Ignacio Central Elementary School, good morning, Sir Camilo Parajas Bulataw. From Lilimasan Elementary School, good morning, Ma'am Jennifer Bacoto Ferrer.
Yes, sir. Hello, everyone. Good morning po.
Morning. From Payapa Elementary School, magandang umaga, Ma'am Adalia Diaz Masiglat. From Tarese Integrated School, magandang umaga, Sir August Berceles Cayabyab.
Hello po. Good morning.
Good morning, sir. From Taragtag Elementary School, hello, Ma'am Leilani Permin Perer. Let's proceed to District 3A, Apunet Elementary School. Good morning, Ma'am Lenny Pasco Agamaw. From Baldog Elementary School, Ma'am Josefina Rosario Joben. Happy birthday. From Isla Elementary School, magandang umaga, Ma'am Marisa Nucom Rosario.
Good morning po, sir. Good morning, Ma'am Lourdes. Good morning po sa lahat.
From Libas Elementary School, hindi natin na-edit our comrades Joselito Villanueva, and now is pinamumunuan ng ating kasama from District 4, Juliet Smith. No? From Panguluan Elementary School, we have Evelyn Litia Malikdem.
Yes, sir. Good morning po sa ating lahat.
From Payar Elementary School, we have Sir Jerome Gutierrez Rosario.
Good morning, sir. Good morning po sa lahat.
From Talang Central School, good morning, Sir Wilson de la Cruz.
Good morning po sa lahat. Good morning po, Sir Marlon.
Mayo Elementary School, Sir Tony Acosta Aquino. Good morning.
Good morning po.
Hello, sir. District 3B, Antimangol Elementary School. Magandang umaga, Ma'am Berhinia Layacan de Guzman. From Balaya Elementary School, magandang umaga po, Ma'am Cecilia Parajas Resuelio. From Balaya Elementary School, magandang umaga, Sir Danny Resquid Beltran.
Good morning, sir. Good morning po sa lahat.
Good morning. From Bugawan Elementary School, good morning, Madam Merlina Magno Sanchez. From Candido Marceliano Integrated School, magandang umaga po, Vilma Rosario Pararas.
Morning. Morning, sir. Morning po.
From Gamata Elementary School, Sir Alvin Kasingal Pukis. Magandang umaga, sir.
Good morning, sir. Good morning po sa lahat.
From Mabalbalino Elementary School, good morning, Sir Armando Solis Binuya.
Good morning.
From Salinap Yes, Sir Armando. From Salinap Elementary School, magandang umaga po, Sir Carlito Caranto Kanilang. From Don Pablo Tulagan Elementary School, magandang umaga, Sir Marshall Ilumin Tamundong.
Aloha morning po sa lahat.
Yes, let's go now to District 4A.
Sir Marlon, excuse
Yes.
me po. Sa District 1B po, Sir Marlon,
Apo.
I'm with 4 principals ng District 1B kasi nagmo-monitor kami ng exam.
Ay, okay po. Sige po.
Andito si Sir Bolten. Sir Bolten.
Hello, sir. Good morning.
Ay, okay. Sige
From
po.
Pampang.
Okay
Then
po.
Sir Jerry. Then we have
Okay.
Jerry Kabuang. Andito po si Sir
Yes po.
Jerry.
Sige po,
Okay.
sige po.
For your information
Social
po, Sir
distancing,
Marlon,
ma'am, ha? Huwag kayong magtabi-tabi dyan.
Yes. Maluwang ito, Sir Marlon. Team kami, nasa gym.
Sige po, sige po. Enjoy. From District
Thank you,
4A, Abanon Central School, Ma'am Juliet Gutierrez
po.
Risquit.
Good
From
morning, sir. Good
CCG
morning, everyone.
Gutierrez Elementary School, Ma'am Myra De Vera Peralta. Good morning, ma'am. From Kalubawan Elementary School, we have Ma'am Digna Season Selmo. Magandang umaga po.
Good morning, sir.
Good morning. From Kawyang Kilik Elementary School, we have Sir Edgar Mamaril Samera. Good morning, sir. From Gullo Integrated School, we have Ma'am Gertrudes Rosario Marceliano. Magandang umaga po, ma'am. From Supo Elementary School, Ma'am Joanna Lisel Arcangel Castro.
Good morning po, sir. Good morning po sa lahat.
Yes, ma'am. From Tubag Elementary School, we have Sir Christopher De Guzman Macasias. Good morning, sir.
Hello everyone. A grace-filled morning po.
Hello, sir. Next slides, Ma'am Gail. District 4P, Pacnar Elementary School. Good morning, Ma'am Jonah Pascua Basto. From Balite Sur Elementary School, magandang umaga po, Sir Glenn Hasmin Fernandez. From Bulusan, Kaingal Elementary School, magandang umaga, Sir Leopoldo Malasan Samera.
Yes, good morning po, sir.
Good morning,
po
sir.
sa ating lahat.
From Magtaking Elementary School,
Hinakil yun na.
magandang umaga, Ma'am Arlene Umagtang Mendoza.
Good morning, Sir Marlon. Good morning po sa lahat.
Morning po. From Mestizo Norte Elementary School, magandang umaga, Sir Rolando De Guzman.
Good morning, Sir Marlon. Good morning, Ma'am Lourdes.
Okay.
Sir Dado, and to all. Good morning.
Malospos Elementary School, good morning, Sir Ricardo Mamaril Torrio Jr.
Good morning, Sir Marlon. Good morning po sa lahat.
Turak Elementary School, magandang umaga, Sir Castro Rosario, Sir Samuel.
Good morning, Sir Marlon. Good morning
Hello.
po sa lahat. Good morning.
Let's now proceed to District 5A. Pulingit National High School. Good morning, Sir Orlando Katunggal Salvador. Magandang
Good morning,
umaga,
Sir Marlon. Good morning sa lahat.
Morning. From Cubol National High School, good morning, Madam Jeannie Tuason Berceles. From Kuliling National High School, magandang umaga po, Ma'am Julia Kayabyab Tagulaw. From Duyong National High School,
Yes, watching.
magandang umaga, Francisco Gabuwa Jr., Junio Jr.
Magandang araw po, sir. Magandang araw po sa ating lahat.
Good morning. From Lilimasa National High School, magandang umaga, Ma'am Marjorie Palisok Mundero.
Good morning, Sir Marlon. Good morning, everyone.
Hello po from Sepnas, our
Good
very
morning.
own Ma'am Marites Velasco Kabatbat. Good morning.
Good morning. Good morning, sir. Good morning
Yes.
po.
From Tandok National High School, Sir Tomas Garcia Ferrer. Good morning po. Let's proceed to District 5B, Ma'am Gail.
Sir Marlon,
Ayun. Yes, ma'am.
are you done?
Hindi pa mo. District 5B, we have Abano National High School. Sir Raul Soriano Bautista, good morning po.
Are you taking note of those who are not responding?
Yes, ma'am.
Okay. Because I receive also some text messages here saying that some of our school heads are watching through
yes, ma'am. Some are watching through MS Team Lives, ma'am. Parang sa YouTube, ma'am.
Bacnar
National High School.
There are only 98 here, and we are expecting more teachers supposed to be to come and join
yes,
us.
Ma'am. Yes, ma'am. From Bacnar National High School, we have Sir Bernard De Vera Magat.
Good morning po. Good morning, sir.
Yes, thank you. At pasok kayo. Libas National High School, Sir Jeffrey De Vera Munoz.
Morning, sir. Good morning po sa lahat.
Balbalino National High School, Sir Johnny Munoz Pascua. Magandang umaga, sir.
Magandang umaga rin po.
Para Malacanang National High School, we have Ma'am Evangeline Ponce Liwana. Good morning po.
Aloha, sir. Good morning to everyone.
Opo. From Pangalangan National High School, Sir Mario Mamaril Barte Jr. Magandang umaga po. From Salinap National High School, Ma'am Rica de la Cruz Macam. Good morning, ma'am.
Morning po. Morning po,
From
ma'am.
Tamayo, yes, ma'am. From Tamayo National High School, Ma'am Janice Torrecampo Datwin. Magandang umaga po.
Magandang umaga din po, sir.
Yes po. From Turac National High School, Sir Rogelio Pasco de Guzman. Good morning, sir.
Good morning po, Sir Marlon. Good morning, everyone.
Yeah, so let's now proceed sa Office of the SDS, Ma'am Lourdes de Servido. Good morning, ma'am. And with the team, Winnie Ann de los Santos, Katrina R. Palarowan, Jerome Ruslan Lanuhian, Arvin King Agbuya, Ricky Salvador, Rica de la Cruz Macam, Janice ano lang yan, no? Naisama lang. And I understand that most of them are watching doon sa ating live, no, sa YouTube. Finance Unit, we have
Wait. Ito muna, sir.
Yes, Office of the ASDS, Sir Diosdado Cayabyab. With the team, RC Paul Aquino, Janice Biagtas, Attorney Liwa Washapno from the Legal, ICT Norman A. Flores, and Celeste Dumantay as part of the OSTS, Rio B. Q. Baon. At alam kong itong mga to ay nanonood sa ating YouTube live, no? Live stream sa MS Team. Next, ma'am, from Finance Unit, OSDS, we have Ma'am Benedicta Paningbatan, Clyde David Adriano, Janet Walsian, Chona Peralta, Blesa Ara Aquino, Jovelyn Garcia, Marilyn Salazar, Russell Mercado, Annabel Francisco, Daisy Cancino, Rubilin Sanchez, and Myra Bulayo. They are watching. From OSDS Budget, headed by Ma'am Charity Pasukin.
Good morning, sir.
Yes, thank you at nakapasok kayo, no? Ma'am Roselyn Pire, Ma'am Ruby R. Camara, Administrative Officer, Sir Nelson Peralta and the team, James Lee D. Mulik, Cho Mark Beltran, Mervin Pasukin, Yolanda Valin, and Ram Alexis Arquiliano. Good morning, everyone. Sa ating cash, headed by Ma'am Jocelyn E. Salvador. Nakapasok ba sila? Ma'am Eileen Giselle Harillo, Baylin M. Banyo. Sa records, headed by our Ma'am Maria Cristina N. Mamorno, Banjilin A. Paronable, Donnie Nicolas, and Susan Pukis. I understand that you're watching sa ating live YouTube channel. OSDS personnel. Lodia Di Castro, the chief of SRD, nandito sila. And the team, no? Sir Nelson Gutierrez, Annalyn Castro, Maria Margie Mendoza, Maria Jana Patricia Senting, Rosalind Ursua, and Sir Bernard M. Risgit. And for the property and supply, headed by Sir Agripino C. Posadas. Hello, sir. Clint B. De Vera, Rozier Ann Payupay, and Matthew G. Katakutan. Good morning po sa inyong lahat. Sa ating General Services, Sir Raul Aquino, Mario Magalong, Ronald D. Guzman, Saturn Carino, Bernardo Sanchez, Edgar Macaraeg, and Jack Lord Binluan, ang ating mga masisipag na kasamahan. So from the CID, Office of the CID Chief, Dr. Edita R. Pridas, with Sir Resnard Risngit, Instructional Management, Milagros S. Dangat, our EPSS, Jesus M. Macam, Sir Alan Macaraeg, Ma'am Lilibet Magtang, Ma'am Minerva Munoz, Ma'am Vivian Ofanda, Sir Virgilio Padlan, Ma'am Anita De Vera, and Ma'am Ruth Aniber Lee Nicolas, ang kanilang kasama sa office. Next, Gail. Our District Instructional Supervisors, our PSDSS, we have Ma'am Josephine Rosario, Ma'am Milagros Fernandez, Ma'am Ellen De Guzman, Sir Alejandro De Imos, Ma'am Priscilla Victorio, Sir Benjamin Risngit Jr., Sir Jaime Hermosado, Sir Oscar Binuya, Ma'am Lirio Patayan. Good morning po. Mabuti nakapasa kayo, Sir Oscar. Ma'am Lirio Patayan, and also Ma'am Gemma Custudio. Magandang umaga po sa ating lahat. And alam ko yung iba nanonood sa ating YouTube live. So meron tayong option kung saan pwedeng makinig. Next one is from Alternative Learning System. We have Robin Jane A. Rosario, Annabel G. Binlawan, John Hill Camacho. We have Sarina De La Cruz, Acelea Pascua, Remilyn Badong, Janet C. Mislang, Ma'am Alhena C. Balyo, Gideon Espridas, and Mary Grace Saison. Magandang umaga sa ating mga Alternative Learning System team. From the Learning Resource Management, nag-iisa na si Sir Marco, no? With Madam Ellen De Guzman, no? Alternative Learning System, Lorna M. Kagiwa, Sir Toribio Eristingcol II, Lourdes Caranto, Ma'am Violeta Cayabyab, Sir Marte B. Ilumin, Sir Alexander Roque, Ma'am Ana Jinky Peralta, Ma'am Vanessa Adriano, and Ma'am Mary Grace Esguera. Magandang umaga po sa inyong lahat. From the Office of the SGOD, no? Sir Villamor Gloria, yours truly, and also our beautiful Sailin Lacaba, nandyan ka ba? For the SMMNE, Ma'am Glenda M. Doria, good morning, po. Together with her partner, Sir Roldan Eden. No? Good morning, sir. Our educational facilities, the Debonair Engineer Jesus Blair Cruz. Are you there? Sa ating planning officer, no?
Driving, sir.
Kailangan mo papasin si Sir Jess, no? Planning officer, Sir Renante Camara, kumusta po?
Good morning.
Sir Lepe G. Bautista and our very own Christian Emmet Estrada.
Good morning, sir. Good
Good morning,
morning,
everyone. Good morning, everyone. Next, Gail. For the SOC Mob, how are you, Ma'am Vilma Beltran? And to the MC of the day, Ma'am Gail Galban, kumusta?
Hi,
From
sir.
the DRRM, Sir Ryan Joseph Acosta. Good morning, sir. The Team Youth Formation, Sir Joselita Panuyas and Ma'am Madeline Suarez. Good morning sa inyo.
Morning po.
Good morning. And to the Team HRD, headed by the very beautiful Ma'am Maria Evelyn Murillo and Ma'am Raquel Arcia. How are you?
I'm good, sir. Good morning, everyone.
Yes. And to the medical team, ang magagaling na mga frontliner natin, headed by Dr. Urbano M. Benitez Jr. Good morning, Doc. And to our beautiful nurses, Marites C. Harillo, Veronica Nabal, Susana Galvez, Ma'am Mildred Diego, Annalisa
Good morning,
Cruz.
sir.
Good morning, Ma'am Maria Soyla Nena Tendero, Sheila Dulay, and Maria Aurora Sibayan. Magandang umaga sa inyong lahat. Sa ating next game. Ayun, sa ating dental team, dental unit, headed by Dr. Rosabella RC. Good morning po. With the team, Sir Dr. Dennis Padlan, Tito A. De Los Santos, Renato Evangelista, and Ma'am Milania De La Cruz. Magandang umaga po sa inyong lahat. Ayun. So, salamat po. Napakahabang checking of attendance. But then again, always stay safe at mag-iingat po tayong lahat. Magandang umaga sa ating lahat. Thank you.
Sir Marlon, nandito na rin si Sir Re,
Yes po, sige po. Sige po, Ma'am Josephine.
1B, Sir Marlon.
Sige po, Ma'am Josephine. Salamat po sa heads up.
Dito siya ate na para makita mo siya.
Okay na po. Salamat po.
Okay, thank you.
Take it away, Gail.
All right, thank you so much, Sir Maron, for the roll call. Okay, to continue, to give us a motherly, inspirational message, may I call our pretty and competent Schools Division Superintendent, Ma'am Lourdes D. Servito. Take away, Ma'am.
Thank you. Thank you so much, Gail.
Welcome, ma'am. Take it away, ma'am.
Am I loud and clear?
Yes, ma'am. Okay.
Aloha morning, everyone.
Good morning, ma'am.
Morning, ma'am.
Morning, ma'am.
Good morning. So, on the screen, there are 99 class connected to MS Teams. And as of the moment, there are 258 watching from YouTube. I think this number is still not sufficient. You know, we have more than 2,000 teachers. And so please, I have a note over here at the chat room asking all school heads to please connect to your teachers. So I hope they can join this virtual orientation on vaccination. So that is how we regard this activity today. It's really very important to all of us. So once again, I would like to greet a pleasant morning to everyone. Let me also acknowledge our top management, of course, with our ESDS who just welcomed us, and of course, Sir Josdado Kayebyab, our chiefs, CID and SGOD, of course, Chief Edit and Chief Amor, respectively.
Good morning, ma'am. Good morning po.
Good morning.
Aloha morning.
Yeah, aloha morning. Sir Nelson Peralta, our Administrative Officer 5. All the unit heads, of course, all our staff and personnel of the SDO San Carlos City family. Our dear school heads, I hope you are all there. Some of you did not respond to the checking of attendance, but I just hope you are there. I hope all your gadgets are functioning. And also, once again, I would say, please connect and instruct all your teachers to join us in this vaccination orientation, because, as I said, this is very important to all of us. So I would like to thank our invited resource person, Dr. Romary Joy S. Castillo, our Medical Officer 4 of Region 1. Thank you so much, Dr. for being a part of this advocacy and campaign for vaccination against COVID-19 and its mutants and variants. Hopefully, all the mutants and variants will also be included. And so with our Medical Officer 3 at the SDO, Doc Banong, I hope you're there. Dr. Urbano Benitez, I should say. And our nurses, right now, I am receiving a text and photo messages that some of our nurses are currently being vaccinated on the second dose, okay? So right here, this is Al showing me that she's got vaccinated already. So Aurora Sibayan. And I'm asking how many of them have already been vaccinated. And she said there are 9 school health personnel who have been vaccinated already. So vaccination is ongoing at the Arenas Risuelio gym today, at this moment. So our health personnel had their shots already. It's already their second dose today. So I hope it's going to be our turn. Of course, we are A4 and hoping that we can already have also our vaccines. So I'm getting here an update. Thank you. There are additional participants over YouTube. There are now 331. Okay, so I know that during the initial vaccination events that are happening within the country, there are some of us who are hesitant, who are adamant, or maybe are afraid of taking the vaccines. But, well, we really have to have this information campaign, this advocacy, to tell everyone that it's very important for all of us to be vaccinated. It is not just for our own safety, but for the safety of everyone. So no one is exempted. So we could really have a better life. I think we will never go back to the old normal. We are now in the what's so-called new normal, but we have to strive to build a better normal. And one thing that we can do to really achieve a better normal is for us to follow the health protocols and be vaccinated. Okay? So, like I said, we will never go back to the old normal. Since we are all advised that even if we are totally vaccinated, we still have to follow the health protocols. So that is very important. So the local government has passed some guidelines, new guidelines that are emphasized that everyone should follow so that we can be safe. So it's better to obey than be sorry, right? So I also admonish. Where is that sound, please? So I guess this is a very serious matter. So please, let us all open our ears and let us all be convinced that we need to be vaccinated. And as I said, I am emphasizing on following the health protocols. I am alone here in this recording room, so, well, I unmask myself. But of course, if we are with someone or if we are in public places, so we must follow the wearing of the mask and the face shields and all the health protocols. Diba? Health protocols, sana all, sabi nga nila. So everyone will be protected. And of course, let us not forget to pray for ourselves, for our family, and for everyone else. So we pray, but we also have to do our part so that we will be protected. And just the same, even if we are vaccinated, we still have to follow a healthy lifestyle. Even the food that we eat, of course, those that we drink. So we have to be very careful. So we care for everyone. That is why we're having this orientation, and we are spreading this advocacy for everyone to join the vaccination campaign and to be vaccinated. We are educators, so we have to show this example to the community where we live, and we have to disseminate this information also to the members of the community. So we may not know, nandyan lang sa kapitbahay or what, nandyan lang sa paligid-ligid yung unseen enemy. That is why huwag nating kakalimutan yung mga palagi nating inire-remind sa ating lahat yung ating mga health protocols. Okay, so I don't think I need to say more because we have invited very competent speakers to tackle the matter. So on my part, I just really want to emphasize the importance of this particular health regimen. We really need it, and we have to inform all the rest of the DepEd family. It is Back to School Vaccination Campaign. So yung back to school na ngayon, naging VACC to school. It looks like the message is we cannot go back to school if we are not vaccinated. Parang ganun ba yun? So we have around 2 months just before we go back to school. And during this time, we hope to be vaccinated. Alam nyo, even as a child, medyo takot ako sa needle, but then I had to have it. Okay, I have to have it. So, kailangan ko talagang vaccinate. Basta ako'y, ano na lang, I just closed my eyes and then, ganon. So, let's take it. All right? So, lahat dapat ano to?
All right, everyone, please follow our superintendent.
Everyone. No, everyone among us, if we really have to go back to school, let's do the back to school vaccination. Okay, thank you, everyone. Good morning. God bless us all.
All right, thank you so much to our mother, SDS, Lourdes, for the inspiring message. So again, I would just like to reiterate what our superintendent have said. We can never go back, but we must strive to build a better normal. Of course, follow health protocols, sana all, and of course, having a healthy lifestyle. Again, thank you so much to our superintendent, Ma'am Lourdes D. Servito. Okay, before we proceed with our program proper, may I request everyone to have a minute of exercise? Would you like it? Anyone from the group, would you like it? Yes, vaccinated. Yes, ma'am.
Yes, Miss Gail.
Okay, so I would just like to say, please put your hands up. And then move your hand circles. Okay, 5, 6, 7, 8, 8, 7, 6, 5, 4, 3, 2, 1. And then on the side, 1, 2, 3, 4, 5, 6, 7, 8, 8, 7, 6, 5, 4, 3, 2, 1. And then down. 1, 2, 3, 4, 5, 6, 7, 8, 8, 7, 6, 5, 4, 3, 2, 1. Okay, your head, move it from your left. 5, 6, 7, 8, 8, 7, 6, 5, 4, 3, 2, 1. And on the right, 5, 6, 7, 8, 8, 7, 6, 5, 4, 3, 2, 1. Slightly bend at the back. Dahan-dahan lang po baka tayo mahilo. So 5, 6, 7, 8, 8, 7, 6, 5, 4, 3, 2, 1. And in front po, 56788765432 There you have it, our minute of exercise. So I hope everyone is already relaxed and very comfortable right now. And we shall move forward to our program proper. Thank you too. Yes, ma'am. Thank you to everyone who participated in the minute of exercise. Okay, moving forward to our program proper. With that minute of exercise, we hope everyone is ready to attentively listen. All right. Our first speaker to discuss the vaccination campaign, may I call our Senior Education Program Specialist of Schools Management Monitoring and Evaluation, that is SMME. Sorry for the typographical error. That it was printed on the program. It's SMN, but actually it's SMME. Okay, the lady who thinks challenges in a positive way. Let's welcome Ma'am Glenda Doria. Ma'am Glenda.
Thank you, Miss Kate, for that
Take it away, ma'am.
Introduction. Okay. To our always gorgeous and eloquent SDS, Ma'am Lourdes Servito. To our debonair ASDS, Sir Dado Kayapia. To our two dynamic chiefs, Ma'am Edith, Sir Amor. To our AO, Sir Nelson Peralta. To all our EPSs, PSDSs, my fellow unit heads, the school heads, teaching and non-teaching personnel of SDO, SEC, a pleasant morning to one and all. My task is to convey the appeal of Secretary Briones to help the Department of Health realize the program, the National Deployment and Vaccination Plan that they have for the vaccination of the entire Filipino, of all Filipinos. And since we have committed, according to Secretary Briones, since we are committed to help them, then we are also tasked to help them disseminate and make people more aware of the vaccination program. That's why we really have to strengthen the vaccination campaign. And so to start with, okay. Can you see the slides now? There. Okay. For the vaccination program on your screen, can you see na po yung what I'm sharing on your screen?
Yes po, Ma'am Glenn.
Yes, ma'am.
Yes, ma'am. These are the different brands of the vaccines that are already available. But the discussion of which I'm going to leave to the authority, who is, of course, Salvador later. So,
Can it enlarge this? So small kasi mabasa.
Wait lang po. Medyo nawawala yun.
Rest bakuna. O yun lang ang mabasa ko dito. Mukha yung bita.
Oo nga po. And then the program. Yan po. Pero si Dr. Salvador na po ang may authority na mag-discuss po niyan. What I am tasked to discuss is the information dissemination plan. So on your screen, you have the National Behavior Change Campaign. campaign. Ugnayang pang-paaralan tungkol sa pagbabakuna para sa kalusugan ng bayan. This is in partnership with Unilab's AKAP Guro Connected Program. The Vaccine Cluster Task Group on Demand Generation and Communications. For DOH, you have the Res Bakuna, Kasangganang Bida, Res Bakuna, Kasangganang Bida, Solution Plus sa COVID-19. Then for the Presidential Communications Operations Office, you have the Explain, Explain, Explain under the Philippine Information Agency po yan. And then for the private sector-led institutions, you have Ingat, Angat, Tayong Lahat. So dito po, sila po yung mag-i-intensify ng ating vaccination campaign. The objectives of the campaign is, of course, one, to inform and engage the department stakeholders, especially teachers, in the promotion of vaccination and other related policies to mitigate COVID-19. Second, to maximize available platforms for the contextualized Bida Solution Plus sa COVID-19 campaign of DepEd. And third, to aid the Department of Health and the Interagency Task Force on Emerging Infectious Diseases in promoting the Bida Solution Plus campaign in the education sector. So this is our concern. Now, the key messages that we are to disseminate or convey to our stakeholders, one, tamang impormasyon. Hindi haka-haka, hindi chismis, kundi kung ano yung tama. Accessible and accurate information. Second, kabuuang partisipasyon, stakeholders engagement. How are we going to involve ourselves? Okay? Hindi lang po tayo maghihintay ng mga guro at bilang mga what do you call this? Public servants sa larangan ng edukasyon. Third, pagbibigay imunisasyon, hindi po sa atin ito. Hindi po tayo ang magbabakuna sa kanila. Bagkus, sasabihin po natin sa ating mga stakeholders kung sino ang magbibigay ng immunization. Kagaya nga po ng sinabi ni Secretary Liling, hindi po trained ang mga teachers na magbigay ng bakuna. Pero pwede po tayong mag-help na mag-disseminate kung ano yung mga advantages ng pagbabakuna. And then fourth, pagbabago sa pag-uugali, behavioral change. Actually, this is the task of the teachers when we teach, right? Hindi lang po natin ituturo yung kaalaman, pero ang ating success sa pagtuturo ay mami-measure if we can see behavioral changes among our learners. Okay po. So these are the key messages that we are expected to convey to our stakeholders. Now, if you notice po, some of the DepEd personnel of SDO, SEC have started using the frame na VACC to school. This, if you're just going to visit my profile pic po, pwede nyo pong magamit yung frame na ginamit ko in intensifying the advocacy of having vaccines through by using the frame in our profile pics. Now, ang meaning po nun is or the objective of the frame would be one, to show DepEd's commitment to the mandate. Second, commitment to truth. Third, commitment to health and safety. Of course, for the protection of oneself, protection of learners, protection of family, protection of community, as well as the commitment to the promotion of informed decisions. So yun po yung objectives ng paggamit natin ng frames. Now, the link may be also be disseminated to our group chats later on. Ito po yung ating campaign brand. This one, Back to School, ligtas na bakuna para sa balik eskwela. This is the department's overall communication plan to inform and engage teachers and other stakeholders on vaccination and other COVID-19 mitigation activities. Yan po. Yung syringe po symbolizes the commitment to the truth, notwithstanding challenges. The cross represents hope, health, and balance amidst the crisis. Yan po. Okay. Next, we have the meaning of the colors. Blue radiates the trust in the government's efforts. Orange conveys confidence and encouragement in the vaccination process. And green communicates the renewal of energy after being resilient with whatever challenges. Yan po yung meaning ng colors ng ating logo sa DepEd about vaccination. Now, co-branding with the central office, we have, along with our logos, the newest is, of course, our VACC to School logo on this campaign, VACC to School campaign. This is also, of course, in line with Healthy Pilipinas, Sudong Edukalidad, Bida Solusyon, and Res Bakuna of DOH. Okay. For the strategies, may I introduce the Back to School campaign characters. We have Teacher Edna and Doc Edu. DepEd Philippine social media pages will create and introduce the characters of Teacher Edna and Dr. Edu and learners Kay and Sean to promote their branding of the campaign. Kung meron po tayong Carlos and Carlene, ang Back to School campaign characters po ay si Kay and Sean. Ayan po, naka-thumbs up po sila sa Back to School campaign gesture. Now, the Department of Education will adopt specific hand gestures to amplify the key message, which is for the stakeholders to receive vaccines for a safe reopening of schools. Ito po yung binabanggit ni Dr. Dado Kayabyab kanina nung nag-welcome po siya. The V sign, which is done by the right hand's index finger and the middle finger pointing to the left side. Ginagawa po ba ninyo? Subukan po natin gayahin. This signifies the vaccine uptake. It also represents the number 2 in the Back to School campaign, which stands for the harmonization of the Back to School of DepEd and the Back to Bakuna of DOH. Meanwhile, the thumbs up pointing to the right side of a person signifies excitement and invitation to participate in the campaign for a normal and safe reopening of schools. For our banner, should you wish to intensify the campaign in your communities, meron po ito, pwede po nating ipa-tarpaulin. Protektahan ang ating pamilya, paaralan at pamayanan. Alamin ang tamang impormasyon. Magpabakuna na. Yan po. Then we have for the new media infographics. In fact, the schools are also encouraged to make their own IECs like this. Bida itong nandito po. Bida for bawal walang mask at face shield. I-sanitize ang kamay at iwasan ang kulog na lugar. Dumistansya ng 1 metro at limitahan ang pisikal na interaksyon sa iba. And A4, alamin ang tamang impormasyon. Bida yon. Ano yung plus? Suportahan ang FDA-approved na bakuna. Okay, so yan po yung Bida Plus. Another new media where this is promoted, where this campaign is promoted, is on town hall meetings and workshops, where they have medical group town hall topics from the town hall, review of current evidence, vaccine selection process, vaccine deployment plan, and addressing vaccine hesitancy, which we can also watch on TV almost every day. And the second one, where we are involved, we have town hall meetings and workshops, planning workshops for championing vaccination in DepEd. How? A, kumustahan. And our TOT follow through. Second, orientation on the NVDP memo, National Vaccination Deployment Plan memo. This is what we are doing right now. Letter C, we have VACC to School campaign. Letter D, planning the output, how to cascade the plan per region aligned with DOH design using the public affairs service contextualized resources. And lastly, learning needs analysis. The output or the list of topics of succeeding webinars for school health and nutrition personnel ng Department of Education. So some are making cards, motivational cards such as this. Actually, our SICs are also encouraged to make their own, pero simplehan lang at saka yung naaayon lang sa ating kaalaman, dahil ang ating number one na goal is to give accurate information. So wag tayong magbagaling. Reminders lang po, hindi po tayo mga doktor. So tignan natin itong ating sample motivational cards. It's just para sa kinabukasan ng mga kabataan. Ako'y re-res bakuna kasangga ng bida. Ginagamit pa rin kung ano na yung binibigay ng DOH na terms. Para sa tuloy-tuloy na pagkatuto ng ating bayan, ako'y re-res bakuna kasangga ng bida. So ganyan lang po. Hindi po tayo mag-promote ng sarili nating brand or whatever na FDA-approved vaccine. Hindi po tayo mag-a-advertise, kumbaga. Dahil may sariling kakayanan na po ang mga magpapabakuna sa pagpili ng kung anong brand or kung anong available na pwede nilang ipaturok sa kanila. Another new media is coming up with testimonials among the people who have already gotten their vaccines. Another, yung TikTok, sa paggawa ng TikTok. You have, tara, sabay-sabay tayo mag-VACC to school para sa proteksyon ng aking pamilya, paaralan at pamayanan. Ligtas na bakuna para sa balik eskwela. Sama-sama tayong magpa-VACC sa school. First, may chant. Second, yung hand gesture, yung V gesture. Tapos, Yun po. Kung kaya nating i-TikTok yan, mas maganda po. And then for campaign posters, we already have a readily available one. Made, gawa na po ito ng ating central office. Protektahan ng ating pamilya, paaralan at pamayanan, alamin ang tamang impormasyon, magpabakuna na. So yung cascading process actually is from DOH, IATF, World Health Organization, DepEd, RO to DO. Ito po, who are in charge, DepEd Central Office, Public Affairs Service, down to DepEd Task Force COVID, DRRM, and to DOH. And these are the following strategies. Using the social media, outdoor advertisements, infomercials, press releases, press conferences, and microsites. Okay po. So, yan lang po. In process pala po. In process is a DepEd memo on DepEd's participation in the implementation of the National Deployment and Vaccination Plan on COVID-19 vaccines. Nakadetalye po dito how we are involved and what to do, what are we supposed to do as teachers, as educators dito sa National Deployment and Vaccination Plan. It will be coming out very soon. In fact, it's already in the office of the Secretary of DepEd, sa office na po ni Secretary Briones, and will be coming out soon. So, yan lang po, and thank you very much for listening.
Thank you po, Ma'am Glenn.
Okay, thank you so much to our first speaker, Ma'am Glenda M. Doria. So I guess everyone have take down notes of the objectives, key messages, branding, and of course we have met our characters, that is Teacher Edna, Dr. Edu, Kay, and Sean. Okay po, sana po na-enlighten po tayo for this campaign and how we shall disseminate and explain this information. Moving forward, for our guest speaker, allow me to give a brief introduction. This lady is dedicated to improve the health and wellness of the people, with high energy and dependable individual who focus on continued professional development. A licensed physician and certified nephrology nurse, I hope I got it right, formerly works at Pangasinan Provincial Hospital as Medical Officer 3 at the Emergency Department. Presently, Medical Officer of LTO Rosales Pangasinan Branch, Reliever Doctor at PDH San Carlos, Nazarene General Hospital Lingayen, and Luzon Medical Center of Dagupan, and currently the Medical Officer 4 of DepEd Regional Office. May I now call Dr. Romery Joy S. Castillo to discuss the National COVID-19 Vaccination Program. Dr. Castillo, are we in? Wow, you're so much beautiful. You're like an artist.
Oh my God.
We take the floor, ma'am.
Thank you, Ma'am Gail.
Welcome po.
Allow me to greet everyone. To Dr. Lourdes Servito, our Schools Division Superintendent, of Office of the Schools Division Superintendent, Dr. Diosdado Cayabyab, Assistant Schools Division Superintendent, Dr. Editha Pidas, CID Chief, Dr. Villamor Gloria, SGOD Chief, Mr. Nelson Peralta, Administrative Officer 5, to our Medical Officer 3, Dr. Urbano Benitez, and to all the PSDS, EPS, all school heads, all teaching and non-teaching personnel of SDO San Carlos City. Good morning. Aloha. Nakikiuso po ako ngayon kasi...
Good morning, aloha, Doc.
Yes po. Puro aloha kasi naririnig ko. So, makikius din tayo ngayon. So, this morning... Yes po.
You're so beautiful.
Thank you po. And yung introduction po sa akin kanina, thank you, Ma'am Gail. Actually, yung currently doon, binigay ko lang yung CV ko. Hindi na po ako nag-work sa LTO and hindi na po ako nag-relieve sa mga hospitals ngayon. And nagpo-focus po ako ngayon sa regional office. So, yun lang po muna yung work ko ngayon. Baka ma-technical tayo. And yun po, thanks for inviting me. Hindi po ako makatanggi. Actually, may workshop sana ako ngayon sa, yun nga, kanina yung Back to School campaign. And hindi po ako makatanggi kay Dr. Urbano kasi special taga San Carlos. Taga San Carlos din po ako. And yun, thankful ako sa lahat ng dito. And yun, yun po, taga San Carlos, yes, mga amputilayag. So, andito ako ngayon sa San Carlos and yun po, ginigrade ko lahat ng mga andito ay mga participants. And for today po, let me share my screen. Okay. Nakikita po ba natin lahat yung ano po? Yung slides po? Okay.
Wala pa po.
Ay, wala pa. Okay, share. Ayan po. Nakikita po ba natin? Or hindi po?
Wala pa po.
Ay, wala pa. Oh, sorry. Yan po. Okay, sorry po ha.
Meron na po.
Yan po. Yan po. Ang topic po ngayong umaga is about vaccination. Kung anong ba yung programa po ng government natin. Ngayon, we have our new programs naman sa DepEd po. Back to School program, ligtas na bakuna para sa balik-eskwela. Sa DOH naman po, another ano din po ito. Yan, may video pa siya. Ras bakuna kasangga ng bida. Healthy Pilipinas, bida solusyon. Yan po. And for today po, just a brief introduction about my topic. The COVID-19 vaccination program in the Philippines is an ongoing immunization campaign against severe acute respiratory syndrome or SARS-CoV-2, the virus that causes coronavirus disease 2019, in response to the ongoing pandemic in the country. As of May 18, 2021, about 3,299,470 total vaccine doses have been administered throughout the country. 2,512,940 individuals have been vaccinated across the country, with 786,528 receiving the second dose. So, yan po yung update po natin as of May 18. So, ngayon po, Food and Drug Administration po has issued emergency use authorization to 7 COVID-19 vaccine. Ito lang po yung mga vaccines na may emergency use authorizations or what we call EUA. Ano ba itong mga EUA po? Ang EUA po is ito po yung kasalukuyan. Ang mga bakunang magagamit po ay mga investigational. Actually, ang mga bakunang magagamit ay mga investigational drug lamang na pinag-aaralan sa mga clinical trials. So, ang FDA po, pinahintulutan ang mabilis na paggamit o emergency use ng mga bakunang ito upang maiwasan ang COVID-19 sa ilalim ng emergency use authorization. So, dahil yung clinical trials pa lang natin ay nasa phase 3 yung ibang vaccine po, ito po ay inaprubahan po ng Pilipinas. Nag-start po siya noong January, yung approval po ng mga ito. Unang inaprubahan po sa Pilipinas is Pfizer. Second is AstraZeneca. Third, Sinovac. Fourth, Sputnik. Fifth, Janssen. Sixth, Covaxin. And yung last po ngayon is Moderna. So sa ngayon, ang meron lang po tayo dito po sa Pilipinas na binibigay po nila is Sinovac, AstraZeneca, and Pfizer. And of course, yung isa rin po is Sputnik V. Ngayon po, mga tao actually, according to survey, mas gusto po nila ng Pfizer. Yan po. Very hesitant silang tumanggap ng Sinovac. Maybe because dahil galing sa China. Or yun po, nasanay tayo na yung mga galing sa China ay hindi effective. Well, nagkakamali po tayo doon. Ang Sinovac po kasi ay maganda rin po ito. Walang vaccine dito na hindi maganda. Lahat po yung maganda. Sabi nga nila, ang best available vaccine is yung po ang meron. Kung anong meron tayo, yun po yung best available vaccine. Wala po tayong kinakampihan na vaccine or everything. Yung efficacy po niya, hindi rin po natin pwedeng i-compare. Kasi po, iba-iba rin po yung tao na trial. Kumbaga, iba't ibang bansa, iba't ibang panahon, yung iba nauna. For example, yung Pfizer nauna. So, yun po yung kasagsagan ng COVID, right? Last year. Yung iba naman po, Sinovac, yung nasa middle, yung mga September, ganon. Iba-iba pong panahon. So, yung efficacy rate nila po ay hindi po natin pwedeng ipagkumpara. Next, ito po yung mga vaccines na meron tayo ngayon. Yan po yung pinakita ni Ma'am kanina sa campaign yung sinabi niya po. Una dito is yung Pfizer, AstraZeneca, Sinovac, Gamaleya, Bharat Biotech, Moderna, Novavax, and Janssen. So, out of this, ang approved pa lang is 7, like yung sinabi ko kanina. Ang Pfizer po natin ay 2 doses, ang AstraZeneca ay 2 doses, Coronavac 2 doses. Ang isa, ganito na lang po. Isa lang po ang 1 dose. Yun po yung Janssen. And sa storage requirements po natin, sa Pfizer, ang required na storage niya is negative 80 to 60 degrees Celsius, negative 60. So, napakababa ng temperature na kailangan. Ngayon po, ang Pfizer ay meron na po sa Manila. Ngayon po, nahihirapan po silang i-distribute din dito sa province. Kasi po, wala po tayong cold storage. Yun po yung problema. At saka, konti lang po yung nabili or na-deliver na vaccine sa Pfizer. Naubos na ata dun sa Manila nag-uunahan sila kasi gusto nila ng Pfizer. Sa AstraZeneca naman po, may mga deliveries na dito sa Pangasinan, La Union, marami sa iba't ibang lugar po sa Pilipinas. Actually, pinapaubos na yung AstraZeneca ngayon kasi mag-i-expire na po ito sa June. So, kailangan nang matapos. Kasi, di ba, natigil muna yun kasi yung may na-report na adverse effect doon. Pero ngayon, kinukontinue na po ang pagbibigay. Ang Sinovac naman po, yun, 2 to 8 degrees. So, okay lang, same sila ng AstraZeneca. Yung Gamaleya, negative 18 degrees Celsius and below. Ang Bharat Biotech, 2 to 8 degrees Celsius. Ang Moderna is negative 25 to negative 15. Parehas din po sila ng Pfizer, medyo kailangan din nila ng mas mababang temperature. Ang Novavax naman is 2 to 8 degrees Celsius. Janssen is negative 20 for 2 years. So, pwede mo siyang i-imbak sa negative 20 degrees Celsius for 2 years. Kung ilalagay mo naman siya sa 2 to 8 degrees, dapat ma-consume mo na yon ng 3 months. So, efficacy naman natin is, ang Pfizer is 95%. Ang Oxford AstraZeneca is 74 for symptomatic COVID-19, 100% against severe COVID-19. So, itong mga nasasabi ditong symptomatic COVID-19, dito po yung binase yung percentage, kung ilan po yung binigyan ng, yung sa clinical trial po, kung ilan po yung nabigyan ng vaccine na, for example, Pfizer, 95% doon ay effective, if yung efficacy niya is mataas compared sa mga hindi nabigyan ng Pfizer. Po, yun po yung, paano po nila i-compute, ganun po yun. Kino-compare nila. Sa mga hindi nabigyan at sa mga nabigyan. Ganun po yung clinical trial. Sa next po is yung Sinovac naman po is 65 to 91%. Yung 65% po actually, yung 65 sa ibang bansa like Brazil, tapos pataas naman dun sa ibang bansa like yung Indonesia, Turkey. Iba-iba pong percentage yan. Kaya hindi na po natin masasabi na yung Sinovac hindi po siya ganun ka-effective. Yung efficacy niya is mababa. Actually, umabot din po siya talaga ng 91%. Actually, ang mga binakunahan yan sa clinical trial is yung mga health workers po. Health workers. Yung iba, mga ordinaryong tao, yung iba, mga matatanda. Pero sa lahat po ng clinical trial, hindi po tayo gumagawa ng trial sa mga buntis. Doon lang po sa normal, sa age 65 years old above, and 18 years old to 59 years old, ganun po. So, bawal pa po yung bakuna for 18 years old below kasi wala pa po tayong trial. Next po is Gamaleya, 91.6% sa mga symptomatic COVID-19 and 100% against moderate or severe cases. Sa Bharat Biotech naman, 80.6% against confirmed symptomatic COVID-19. And sa Moderna, 94% po against symptomatic COVID-19 and 100% against severe COVID-19. Awaiting po tayo sa Novavax ng phase 3 trial. Ang Janssen po is 66% to 69% against confirmed moderate to severe critical COVID-19. Itong Janssen po ay 1 dose lang, kaya yung ibang tao, mas prefer nila kasi isa lang turok. Takot sila magpabakuna. And yung as to the side effects po, yung mga adverse events reported, ito po yung mga yon. Sa Pfizer, may short-term mild to moderate pain in injection site, fatigue, and headache po yung mga adverse events niya. Sa AstraZeneca po, injection site, fatigue, headache, feverishness, and myalgia. So, sa mga nakikita ko po dito sa Region 1, actually nagko-consolidate ako ng mga adverse effects yung mga tao na nagpabakuna with AstraZeneca. Usually, ito po, sila po yung mga nakakaramdam ng fever chills madalas. Yun po. Yung sa Sinovac na ayaw natin, yung iba ayaw nila. Ito po, ang mga adverse events niya is local lymphadenopathy at injection site. So, para siyang magbubukol ng konti. Tapos, pwedeng may possible allergic reaction. Though, yung iba naman po, may chance din tayo magkaroon ng allergic reaction. Tapos, yung iba po dito sa Sinovac, nagko-convulsion. Pero sa mga na-interview ko dito sa DepEd Region 1, na mga teachers, na health personnels po, na nagpabakuna is, wala naman daw silang naramdaman. Pero, hindi nyo ba alam na may yung mga ibang gusto nila makita yung mga antibodies kung talagang effective ba tong Sinovac na to. Meron po nakikita sa mga Facebook, pero totoo po ito. Pinapacheck nila yung antibodies nila after mabakunahan ng Sinovac. Tumataas po yung antibodies nila like yung same lang po sa mga ibang bakuna. Tumataas din po. So, hindi natin pwedeng sabihin walang effect tong Sinovac. Wala naman tayong naramdaman. Wala pong effect pero talagang effective din po ito. Ang Gamaleya Sputnik, ang adverse effects niya is pain on injection site, hyperthermia or yung mataas na temperature po, swelling. And sa Bharat Biotech, pwede tayong makaramdam ng headache, fatigue, fever, body ache, abdominal pain, nausea, and vomiting. Sa Moderna naman, medyo marami ng konti. Pain, erythema, or swelling on injection site, axillary lymphadenopathy, fever, headache, fatigue, myalgia, arthralgia, nausea, vomiting, and chills. Sa Novavax, wala pa rin pong wala pang report kasi naantay pa natin yung result ng phase 3 trial natin. Sa Janssen po, pain, redness, swelling, tiredness, headache, muscle pain, chills, fever, and nausea. Ito po yung mga eligible groups natin. Alam po natin na ilang beses na tayo nakaka-attend ng mga seminar at paulit-ulit lang po yung na-emphasize yung mga eligible groups natin. For A1 po, ito po yung mga nakabilang dito is yung mga frontline workers in health facilities like both national, local, private, and public. Health professionals and non-professionals like students, nursing aides, janitors, barangay health workers. So kung kabilang kayo dito na hindi pa kayo nagpabakuna, dapat magpabakunan na kayo. So, sa pangalawa naman, A2 or senior citizens age 60 years old and above. Ito pa bang senior citizen, actually, tapos na. Tapos na siya, ongoing. I mean, yung iba, almost all senior citizens na pabakunahan na po. And yung ibang hindi pa nagpapalista sa mga LGU nila, yun lang po yung mga hindi nabakunahan. Sa A3 naman, yung mga persons with comorbidities po. Sa A4, frontline personnel in essential sectors including uniform personnel and those in working sectors identified by the IATF as essential during ECQ. So itong A4 po, expected date na mabakunahan lahat ng to is June. Next month po. Next month, yon. Dapat magpalista na tayo, mag-register tayo. Actually, ito, ginawa yung mga eligible groups, priority groups, para mauna po yung mga most at risk. Importante po talaga yan. Kasi itong mga frontline workers natin, sila po yung nag-aalaga o yung nagmo-monitor sa lahat ng may mga COVID, yung iba po. So, kailangan i-priority sila. Yung senior kasi sila rin po at risk po sa COVID-19, kaya pangalawa sila sa priority at yung mga persons with comorbidities po. And next is yung sa A5, yung mga indigent population. B1, teachers and social workers, yung mga teachers po dyan. B2, other government workers. B3, other essential workers. B4, socio-demographic groups at significantly higher risk other than senior citizens and indigenous people. B5, overseas Filipino workers. B6, other remaining workforce. C, rest of the Filipino population. So, sino po ba yung mga pwedeng bakunahan? Ito po yung mga yon. Ito. Sa may mga history of bleeding, disorders, or currently taking blood thinners, with allergy to food, egg, or medicine, and with history of asthma, pwede silang bakunahan, but with special precautions. Para dito naman po sa currently diagnosed with COVID-19 or with symptoms of fever, kung may chills tayo, fatigue, cough, colds, headache, sore throat, myalgia, loss of taste or smell, diarrhea, shortness of breath, difficulty breathing, and rashes. Yun po. And yung may history na exposure to confirmed suspected COVID-19 case in the past 14 days, has received convalescent plasma or monoclonal antibodies for COVID-19 in the past 90 days, women in the first 3 months of pregnancy, has received any other vaccine in the past 14 days, has had attacks, been admitted or changed medications for their comorbidities in the past 3 months, hypertensive emergency or with blood pressure of 180 to 180/120 with symptoms of possible organ damage. So itong mga ito po, pwedeng bakunahan pero papareschedule natin. Hindi po siya pwedeng, for example, yung may hypertension po, ang BP niya 180/120. Yan po. Pwede nating i-reschedule yun pag hindi bumaba. Pag pumunta ka dun sa LGU, mataas ang BP mo, pwede natin pa-reschedule. Pag hindi nakaya sa rest for 15 or 30 minutes, mataas pa din, or after mag-take ng gamot, ayan po, i-reschedule natin siya. At sa mga na-expose naman po na sa COVID-19 or mga close contacts, hindi rin pwede magpa-vaccine muna. And yung mga may convalescent plasma naka-receive kasi 'di ba? May mga ganun ngayon, especially sa Manila. And yun po, ito po sa next naman po, ito yung mga pwede magpabakuna pero kailangan ng clearance from the attending physician or primary care provider. First is yung may autoimmune disease. Second, yung may HIV. Third, cancer patients currently ongoing chemotherapy, radiotherapy, immunotherapy. And next is underwent transplant. Next, currently taking steroid medications, o yung mga bedridden or in a vegetative state or poor prognosis with life expectancy less than 6 months. So, ito yung mga mabababa yung nila, immune system nila. So, kailangan talaga ng clearance from the physician. Ito naman po yung mga bawal. Okay, hindi sila pwedeng bigyan ng vaccine kasi hindi ka less than 18 years old kasi hindi po kasi sila kasama sa trial ngayon. And yung mga may allergy to any vaccine, vaccine components, example, yung polysorbate, PEG, etc. So, kung nabigyan ka ng vaccine ngayon, first dose mo, tapos nag-react yung body mo, nagkaroon ka ng allergy, may mga pantal-pantal, hindi mo na po ito pwedeng ibigay ng next dose. So, pag nakaramdam ka rin ng severe allergic reaction, yun nga po, sinabi ko, yun, hindi rin pwede na bakunahan. And ito po, next is, ano pong gagawin natin sa mga matataas na blood pressure o yung mga may comorbid na hypertension? Ito po, question dito is, pwede ba akong magpabakuna kontra COVID-19 kung ako ay may hypertension? Yes po, ang bakuna kontra COVID-19 ay ligtas at epektibo sa mga may hypertension upang hindi matapuan ng mas malubhang uri ng COVID-19. Ang proteksyon sa dulot ng bakuna ay mas matimbang kumpara sa side effect na pwedeng mangyari. Mas malaki ang benepisyo ng bakuna kontra COVID-19 para sa mga may hypertension. So, kung hypertensive ka, okay lang mabakuna. Basta yung time na magpapabakuna ka, dapat i-normalize mo muna yung blood pressure o hindi po siya tataas ng 180/120. Po. And second po na tanong is, ano po ito? Paghanda 2 to 4 linggo bago magpabakuna. Ano yung mga paghanda natin bago tayo magpabakuna? Mag-ingat na ma-expose sa mga posibleng may COVID-19 2 linggo bago magpabakuna. So, kung balak mong magpabakuna, alam mong naubo yung mga kasama mo, lumayo ka muna ng 2 to 4 linggo sa mga ka-office mo, sa work mo, sa classroom, etc. Mga kaibigan mo na may symptoms ng COVID-19, lumayo ka muna. Siguraduhin kontrolado ang inyong BP ilang linggo bago magpabakuna. Kaya importante po na i-take natin ang maintenance. Kumonsulta sa inyong doktor kung kinakailangan para maiayos ang gamot ninyo. Inumin ng tama ang maintenance na gamot laban sa hypertension. Ano ang dapat kong gawin sa araw ng pagpabakuna? Una, inumin ang maintenance na gamot para sa high blood. Magbaon ng extra na gamot para sa high blood. Although doon sa iba po, meron na silang nakahanda ng mga gamot para sa mga matataas na blood pressure. Yung mga emergency drugs po. Pangatlo, kumain sa bahay. Iwasan ng kumain sa vaccination center habang naghihintay. Kasi yung iba dito, ang tagal kasi maghintay. Actually, sa Manila, yung iba nag-aantay yung Pfizer, buong araw po sila nag-aantay. So, nakakagutom talaga yun. Pero sabi dito, bago ka daw magpabakuna, dapat kumain ka na doon para, siyempre, yung mga communal eating po, doon din po yung isa sa mga reason ba't tayo nakahawaan ng COVID-19. Next is mag-relax habang nakapila bago bakunahan. Panatilihing malinis ang inyong kamay, magsuot ng face mask at face shield, at obserbahan ng physical distancing habang nasa vaccination center. Ang nangyayari po kasi dito, mga nagkukwentuhan yung mga magkakaibigan, magkakalapit-lapit sila, tapos nakataas. May face mask pero nakataas yung face shield, kaya hindi po maganda yun. Dapat sundin po natin ang health protocol. Yan po. At may mga nakikita po akong mga teachers, mga tao na sa paligid-ligid na yes, naka-face mask sila, pero magsasalita sila, kailangan tanggalin yung mask nila para daw masabi ng huwasto yung sinasabi nila. Yun po, hindi maganda yon. Kapag tumaas ang BP habang nagpapabakuna, anong gagawin? Bago bakunahan, mag-relax at huwag kabahan habang nasa pila. Huwag iminom ng kape o anumang inumin may caffeine 30 minuto bago magpa-BP. Huwag muna kumain. Huwag manigarilyo. Umihi muna kung naiihi. Iwasan uminom ng mga pain reliever or gamot sa sipon na maaaring magdulot ng pagtaas ng BP. Actually, itong mga gamot natin para sa sipon, yung effect din niya is pagtaas ng BP. Kaya bago tayo magpabakuna, huwag muna tayong uminom nito. Pagkatapos bakunahan, ang gagawin po natin ay mag-relax. Yung iba kasi tense na tense, ay nabakunahan na ako, grabe yung anxiety nila. Maaaring gawin ang deep breathing exercise sa loob ng 3 to 5 minuto. Inhale sa ilong, 4 counts. Hold breath, 2 counts. Exhale through mouth, 4 counts. Kung wala namang nararamdaman na malubha, maaari nang umuwi pagkatapos ng 30 minutes hanggang 1 hour, magpakita sa inyong doktor kinabukasan. So, after po mabakunahan, mag-aantay muna tayo ng 30 minutes or 15 minutes to 30 minutes to 1 hour para makita kung ano yung mga symptoms or yung mga mararamdaman natin after bakuna para ma-monitor tayo. Kasi yung iba, wala namang health personnel sa mga bahay nila. Tapos pag uwi sila agad, walang mag-monitor sila kung ano mang klaseng effect ang mararamdaman nila. Kasi individual, ayan, iba-iba yung nararamdaman per tao. Ito naman po, may mga nagtatanong kung pwede ba ang bakuna sa mga buntis. Ito po, next topic natin is COVID-19 vaccines and pregnancy. So, ano ba dapat malaman natin? Can breastfeeding women get the COVID-19 vaccine? Yes, breastfeeding women can get any COVID-19 vaccine despite limited data on this. The World Health Organization states that if a breastfeeding woman is a part of a group recommended for vaccination, for example, health worker ka, vaccination can be offered. So, nagpapasuso ka, tapos nurse ka or doctor, pwede ka mabakunahan. It is not recommended to discontinue breastfeeding before or after vaccination. Actually, itong mga slides ko din galing din po sa DOH. So, hindi ko po ito gawa-gawa lang. Yes, next po, can pregnant women get the COVID-19 vaccine? Yes. It's not a contraindication to getting COVID-19 vaccine, especially dun sa mga health workers na pregnant. Pregnant women can get the vaccine with precaution lang po, given that there is limited data on pregnant women from clinical studies. So, kung buntis ka, sabi dito, hindi naman contraindication yung pregnancy. Pero dahil limited lang yung pag-aaral natin o yung mga clinical trial natin na nagawa na, kung pregnant ka, yun po, yun din ang sabi nila dito na take precaution. Kung papabakuna ka, isipin mo maigi. Kung di ka magpapabakuna, tas buntis ka, dun ka na lang sa bahay. Mag-work from home ka. If a pregnant woman is a part of a group recommended for vaccination, vaccination can be offered. It is advised to get the vaccine after the first 3 months of pregnancy. Kasi we all know na yung first 3 months of pregnancy, very maselan yan. So, yun po ang advice po na sana yung second trimester to third trimester, pwede na po tayo magpabakuna. Pero kung nasa bahay naman po, personally, I advise na okay lang mag-work from home na lang muna tayo kung ayaw talaga natin magpabakuna. So, can those planning to get pregnant get the COVID-19? So, yes, those planning to get pregnant may get the COVID-19 vaccine. Yung mga magbabalak dyan na magka-baby kasi naka-work from home lahat, yun po. Okay lang po na magkaroon ng COVID-19 vaccine. Next is a pregnancy test required prior to COVID-19 vaccination. No, hindi na po natin kailangan magpa-pregnancy test prior tayo magpa-vaccine. However, the pregnancy test may be done for those suspected to be pregnant, missed menses, or unsure of menses. So, tingnan natin, kasi nga, diba, sinabi ko kanina, advice na sana sa second trimester po yung vaccination to third trimester. Yung first trimester, very maselan. So, kung ano ka na sa childbearing age, reproductive years, ilan ba? Yung 20 years or kung hindi ka pa menopause, yun po, pwede ka magpa-pregnancy test, especially yung mga may missed menses, yung hindi pa dinadalaw. Tapos, ayan na schedule ng vaccination. Pwede po tayong mag-pregnancy test bago magpabakuna. Ito po yung mga tanong ng bayan. Maaari ba akong mahawaan ng COVID-19 kahit nagpapabakuna na? Ang sagot is no. Hindi ka maaaring makakuha ng COVID-19 mula sa bakuna. dahil walang live virus sa mga bakunang binibigay ngayon. So yung mga bakuna po natin like AstraZeneca, Pfizer, Sinovac po, hindi po siya yung live virus. Yung iba po yung part ng virus inactivated. Big sabihin, hindi na po siya active. Inactivated nga. Inactivated. Yung iba from mRNA, very medical term, kaya medyo mahirap intindihin. Dahil yun nga po, pero ang thought dito is, kung magkakakuha ka ba ng COVID-19 mula sa bakuna, ay hindi po. Yan. Maaari ba akong magkaroon ng COVID-19 pagkatapos magpabakuna? Oo, may posibilidad na makakuha ka pa rin ng COVID-19 pagkatapos magpabakuna. Subalit, may dagdag na proteksyon ang bakuna mula sa sintomatikong banayad, katamtaman at malubha na COVID-19. Dagdag nito, may protection ito para sa kakailanganin mga ospital at nakakamatay na klase ng COVID-19. So after mong magpabakuna, may possibility na magkakaroon ka pa ng COVID-19. Hindi po natin na-assure lahat ng nagpabakuna na hindi na magkakaroon ng COVID-19. Kaya mas importante po rin tayo after magpabakuna, yung health protocol natin, sundin, mag-mask, hand wash, sanitizer, and yun po, mag-face shield din po tayo, and social distancing, ganun po. So, next is, bakit ako nagkakaroon ng COVID-19 kahit nagpabakuna na? May posibilidad na pa rin makakuha ng COVID-19 matapos ang pagbabakuna kung ikaw ay na-expose sa virus sa loob ng 14 na araw bago maturukan ng unang dose, sa mga araw sa pagitan ng una at ikalawang dose, bago mabuo ang katawan ng proteksyon mula sa bakuna dahil sa hindi pagsunod sa BIDA behaviors at minimum public health standards. Ano ba yung mga BIDA behaviors natin? Yung sinabi ko nga, yung social distancing, wearing of face mask, face shield, yun po. So ito po, pwede ka magkaroon ng COVID-19 hindi dahil sa bakuna po. Mga nagkakaroon po ng COVID-19, sabi nila after magbakuna, yun po pwedeng nahawaan na tayo ng COVID-19 bago tayo magpabakuna. Pwede tayong nahawaan after magpabakuna ng first dose. Kasi po, iba-iba po yung sa vaccine natin. Yung iba, fully immunized ka na after mga ilang araw ng second dose. Like for example, sa AstraZeneca, nagiging immune ka after ng ilang weeks po ng bakuna. And sa, FYI lang po yung AstraZeneca po, sabi nila, di ba, baka hindi na effective kasi natigil yung pagbibigay. Pero hindi po ganon. Yung first dose, ang pagitan nila ng second dose, pwedeng 4 weeks to 12 weeks siya. Kung 12 weeks yung pagitan, mas effective daw ito. Mas maganda yung response ng immune system. So, yung mga nagpabakuna ng AstraZeneca tapos natigil, okay lang po. Mas maganda po yung effect kung mas malayo po yung agwat. Unlike yung Pfizer, 21 days, ganun po. Iba-iba po kasi sila. Yung Moderna, 28 days. Yun po. Tapos yung iba, after ng second dose, mag-aantay ka pa ng 1 week or 2 weeks bago ka magiging fully immunized siya. Kasi nagde-develop pa yung mga antibodies mo doon. So, hindi po natin talaga masasabi na ang cause ng COVID-19 natin ay dahil sa bakuna. Ito po, next, ano ang kailangan kong tandaan kung ako ay magpapabakuna na? Tandaan, kailangan pa rin gawin ang BIDA behaviors, bawal walang mask, isanitize ang mga kamay, dumistansya ng 1 metro, alamin ang tamang impormasyon, at minimum public health standards kahit na kumpleto na ang bakuna para sa dagdag proteksyon. Mga posibleng scenario ng pagkahawa. Ito yung sinabi ko kanina, 14 days before first dose. Yon. Pwedeng inalis mo yung mask mo sa publiko, tapos nagpa-vaccine ka. Tapos pwede ring first dose to second dose yung agwat nila, nagsalo-salo ka sa pantry ng opisina nyo, nakapagkwentuhan ka, ay tapos na ako ng first dose, pwede ko nang tanggalin yung konti, yung pwede na kumain. Hindi pa rin pwede yon. Pwede ka magkaroon ng COVID-19 pa din. Second dose. Ito po yung agwat ng second dose to optimal protection. Nag-video okay ka, kay tapos na, yung mga nagpo-post sa Facebook, tapos na ng second dose, fully immunized na daw. Pero hindi po agad na kinabukasan ay magkakaroon ng optimal protection. Naantayin pa yon ng weeks or days, ilang araw pa yon. So hindi mo pwedeng mag-video okay kasama yung mga kaibigan. So optimal protection, Pfizer, ito po yung sinasabi ko din po. Optimal protection, Pfizer, 7 days after second dose. Ang AstraZeneca po, 14 days after ng second dose. Sinovac po is 14 days after second dose. Gamaleya, 21 days after the first dose. Yan po ang pinaka-short, ay pinaka-mabilis dito is yung Pfizer. After ng second dose mo, 7 days after, fully protected, optimal protection. Yan po. Yung sa AstraZeneca, Sinovac, parehas 14 days. So, after ng second dose nyo, wag muna kayo mag-happy-happy or gumala-gala at practice ang BIDA behaviors.
Beta behavior.
Yeah. Totoo bang may mga namatay dahil sa bakuna? Ito po ay fake news. Hindi. Ang mga ulat ng namatay ay dahil sa COVID-19 at hindi dahil sa bakuna. Walang relasyon ang kanilang pagpapabakuna sa mga naiulat na namatay dahil sa COVID-19. May mga nababalitaan tayo sa mga iba't ibang lugar dito sa Pilipinas dahil ang sabi nila nagpabakuna lang namatay na. Hindi po totoo yan. Baka dahil may COVID-19 sila, bago sila magpabakuna or before sila magkaroon ng optimal protection, nagka-COVID-19 sila, yun po yung mga maaaring sitwasyon kung bakit sila namatay. Or kaya yung mga comorbidities nila, dapat alamin ng wasto kung ano ba talaga yung rason, hindi po tayo pwedeng magkalat ng fake news. Lalo na kasi mga matatanda sa atin, mabilis matakot. Sila po yung mabilis maniwala, kaya takot po talaga sila magpabakuna. Pang-anim, paano ko mapoprotektahan ang sarili mula sa exposure sa COVID-19 kahit tapos na ako magpabakuna? Yung nga po yun, kahit na may dagdag protection ng bakuna mula sa simptomatiko at katamtaman hanggang malubhang klase ng COVID-19, makadaragdag na ka ng proteksyon sa BIDA behaviors. Ito po yung BIDA behaviors, magsuot ng face mask at face shield, hugas, sanitize ng kamay, iwas sa matataong lugar, magandang daloy ng hangin, 1 metrong distansya sa iba. Dahil ito San Carlos, naka-lockdown tayo ngayon. Yan po, sana po wala po yung mga pasyal-pasyal sa mall sa atin kung di naman importante yung lakad natin. Next po is, may lagnat ako at pananakit ng brasong tinurukan ng bakuna. Dapat ba ako mabahala? O, nilagnat daw siya, tapos nanakit yung yung tinurok ng bakuna. Hindi po tayo dapat mabahala. Ang mga sintomas ng pananakit, pamumula at pamamaga sa brasong tinurukan at iba pang sintomas ng trangkaso tulad ng lagnat, pananakit ng ulo at kapaguran ay ilan sa mga karaniwang pangyayari matapos magpabakuna. Ito ay senyales na nagsisimulang immune response ng katawan dahil sa bakuna. Mawawala ang mga sintomas na ito sa loob ng 1 hanggang 3 araw. So yung iba po nakakaramdam ng itong mga sintomas, yung iba umaabot ng weeks ay ng 1 week. Iba naman 3 araw, yung iba walang nararamdaman talaga. So, yun po yung mga sintomas. Next po is, ano ang dapat kong gawin kung tumagal o lumala ang aking mga sintomas? Kumonsulta sa inyong doktor o sa pinakamalapit ng pasilidad. Kung hindi ito mawala matapos ng 3 araw o kung lumala ito ng mga matapos ng 1 araw, yan po. Ito ay senyales na nagsisimulang immune response ng katawan dahil sa bakuna. Mawawala ang mga sintomas na ito sa loob ng 1 hanggang 3 araw. So yung iba po, yung mga sa LGU nila, ina-advisean yung mga nagpabakuna na binibigyan po sila ng contact numbers. Kung may mga naramdaman silang mga adverse side effects na hindi nawawala, tumawag agad dun or pumunta agad dun sa malapit na LGU nyo kung saan kayo nagpabakuna. Sila na po bahala sa inyo. Tsaka kung may mga nakaramdam po ng mga severe allergic reaction, meron po tayo sa PhilHealth, yung mga kasama po yun, covered po yun, may adverse effects, AEFI po. Tama ba? Ayun po. Yan, kasama din po, covered po tayo nun. Next is, paano ako makakatulong na mahinto ang pagkalat ng COVID-19 katapos kong magpabakuna? Kahit ikaw ay nakatanggap na ng unang dose ng bakuna, maaaring mapigilan ang pagkalat ng COVID-19 sa mga kapamilya at sa ibang tao sa komunidad sa pamamagitan ng sumusunod. Manatili sa bahay maliban sa essential activities. Buksan ang bintana para tiyaking may magandang daloy ng hangin. Kumain ng wasto, mag-ehersisyo at iwasan ang paninigarilyo at pag-inom ng alak. Subaybayan ang kalusugan at tumawag agad sa inyong Barangay Health Emergency Response Team or BHERT kung kayo ay may sintomas at posibleng may exposure sa virus. Yun, okay po. Yan po, may another set of slides. I-share ko po. Ito po yung binigay din po sa akin from DOH. So, ayun, okay na. Naliwanagan na tayo sa mga po yung informations na narinig natin kanina. Ito po yung next natin. Ito po yung after ng lecture, kung decidido na tayo magpabakuna. Ito po yung gagawin natin. Step 1. Okay, note down for correct information. Yun nga po yung sinabi ko. Step 2, kung papabakuna na, get master listed with your LGU. Step 3, show up on your scheduled vaccination date. Baka mamaya, hindi kayo pumunta. Come back for your second dose. And step 5, continue observing the minimum health public standards. Step 1, know the correct information. Be informed about vaccines and vaccination program through legitimate and verified sources. Yung diniscuss ko kanina is from DOH website. Yan, pwede nyo i-check yon sa Google. Pwede nyo i-Google yung DOH na information about vaccine. Be an agent of correct information. Know your power to shape other people's opinion. So parang tayo dapat maging advocate. Lalo na yung mga health personnel. Hindi po tayo, kung health personnel tayo, ayaw natin magbakuna. Huwag na tayong mag-encourage yung iba na magbakuna, magpabakuna. Dapat tayo maging advocate or tumahimik na lang tayo kung kung mag-fake news, yung magsabi pa tayo ng fake news about vaccination. Po. Step 2, get master listed with your LGU. The national government is working in partnership with your local government to get the vaccines to you. Your local government unit will arrange for the registration and scheduling of vaccination, as well as identifying vaccination sites. Please wait for specific instructions and announcement from your mayor or governor. Yung sa ibang lugar, ang ginagawa po nila is, meron po silang website, pwede ka mag-register doon. Yan, survey siya. Magre-register ka kaya para hindi ka napupunta sa LGU nyo. Bawas hassle yon. Yan po. Step 3, show up on your scheduled vaccination. Sign the informed consent signifying you are aware of the benefits and risk of the vaccine. And second, willing to get vaccinated. Get vaccinated. Undergo monitoring for 15 to 30 minutes before going home to observe for unusual symptoms or adverse events. Share your breast bakuna story. Meron po tayong mga programa na share your #rest bakuna. Pwede natin i-share sa Facebook, Instagram, or pwede rin sa Twitter, ganon po. #rest bakuna story. Baka kayo po ang mapiling story ng rest bakuna ng DOH. Step 3, show up on your scheduled vaccination date. Usual symptoms may be experienced include pain, redness, swelling, injection site, as well as flu-like symptoms. These are normal signs that your body is building up protection. If discomfort increases after 24 hours, your unusual symptoms are worrying you, you can report to the nearest health authority for appropriate management. Yan po. And step 4, come back for your second dose. Yung iba, hindi na po bumabalik. Okay na. Sabi nila, yung iba kasi nakaramdam ng mga severe side effects, ayoko na magpa-second dose. Pero kailangan po natin yon. Ano po kasi yung, according to some research po, yung iba nakakaramdam ng yung mas matinding side effects after the first dose. Yung iba naman po, second dose, mas grabe po yung effects. Kaya depende po sa tao yan. Kung ano yung response ng katawan natin. Step 5, continue observing the minimum public health standards. The COVID-19 vaccine is just an additional tool to protect ourselves from COVID-19. Even after vaccination, you need to practice minimum public health standards to provide continued protection for yourself and your family. This way, we can be safer from the threats of COVID-19 transmission and its variants. Okay, getting vaccinated is an additional tool to protect not just yourself, but also the people around you. Let us protect one another by getting vaccinated and being agents of correct and scientific information about vaccination and the vaccination program. So, ang goal po natin is herd immunity. Narinig nyo na ba yun? Herd immunity, dapat, for example, Kunwari, 100,000, dapat mabakunahan is 70,000. 70% ng population dapat mabakunahan para maprotektahan tayo, pati yung mga people na nasa paligid natin. Po. Be agents of tamang impormasyon, take active steps to be informed, organize sessions for to engage others constructively, and you can join DOH organized or DOH partner-supported webinars or training. Sabi nga po yung training natin kanina ni yung sa about sa back to school, pwede tayong magpasa like yung TikTok about vaccination. Pwede tayo. Actually, magkakaroon po tayo ng program na ganun. Magpapa-TikTok tayo sa mga SDOs. Ayan, pinauna ko na. Pero hindi pa po na meeting yung criteria of judging. Ayan po. So, yun po yung yun lamang po ang aking lecture po. So, ngayon mas naiintindihan na natin ang tamang impormasyon tungkol sa pagbabakuna. At maaari na tayong magkaroon ng matalinong pagdedesisyon ukol sa pagsasagawa nito. But remember, if you are already vaccinated, you must still follow the minimum public health standards. These include, yun nga po yung BIDA behavior, proper hand washing, wearing of face mask, and face shield, and physical distancing of no less than 1 meter. This is for your own protection and of others. Take care and thank you po sa lahat ng mga sumubaybay at nanood. Yun lang po. Thank you.
Alright, thank you, Ma'am Dr. Castillo. Now I remember kung sino po ang kamukha nyo, kung kilala nyo pa po si Miss Donita Rose, ang ating artista dati. Kung kilala nyo po siya, kamukha nyo po siya, kaya medyo na-shock po ako sa inyo kanina nakita ko. Akala ko nakakita ko ng artista. Okay, so again, thank you so much, Doc Castillo, for the overview of the differentiation of the COVID-19 vaccines, answers to commonly asked questions, giving us the overview of the vaccination process, and of course, the reiteration of the BIDA behavior. Okay, with that, I would like, again, thank you so much, Doc. But please still stay with us. We will be having now our... please stay with us for a little bit. After Doc Banong shall discuss the health protocols, we'll be having our open forum. Okay po, Doc Donita? Thank you so much. Okay, next, to discuss health protocols, we call our very energetic, sobrang energetic po to. Tuwing umaga, I always say to him, good morning, Doc. And binabalikan din po niya ako with a loud voice, good morning, Gail. Ganun po siya. Sobrang energetic ang ating Division Medical Officer 3, Dr. Urbano Benitez Jr. Doc Bano, are we in?
Thank you, Ma'am Gail.
Thank you so much, sir.
Thank you. Good noon. To my fellow lot dyan, my dearest principals in the field, the public servants, listening or not listening, good noon. Okay. Also, our beloved Motherly Superintendent, Ma'am SDS, who initiated this webinar. Okay. Ma'am Lourdes Cerveto, our Assistant Superintendent, Sir Dado, simple, very humble, approachable, and our CID Chief, the approachable CID Chief and brilliant, shining mind, always shining yung head niya eh. Sir Amor, Gloria, of course, the CID Chief, CID Chief, Ma'am Pridas, always intelligent CID, always in live wire. course, yung mga may kasama ko sa si Scood. Lahat ng Scood dyan, andyan na lahat na, may nurses, o etc. Sa division, sa field afternoon. Okay, mahirap magsalita sa mga magagaling na mga speaker Ma'am Glenda, and of course, our medical officer, Dr. Romary, beautiful medical officer. We are proud that our medical officer sa region is from San Carlos. Actually, she's the daughter of Mr. and Mrs. Rolando Salvador. Huwag na kayong magtaka because that's mutations work sometimes. Ano yun? Okay, may topics about minimum standard protocol. Actually, nag-discuss na yung mga iba dito So it's already 11:45. Alam mo, pag tumatanda ka, gutom na tayo, very short span na yung listening natin or understanding. So I will take it to only 5 to 10 minutes. Kahit under the slides yan, we'll make it 5 to 10 minutes. Ganun ako magsalita Okay, paano yun, ma'am? Okay, wait lang kasi mahina ang signal natin. Kailangan na mabilis na to next time. Ano yun? Actually, they talk about vaccination. Bakuna. But remember, kung minsan yung may mga asawa dyan, huwag yung dalhin niyang asawa nyo pag bakunahan kayo, So, I will like to share this little video. Nasaan na yung video natin?
Ayos tandok.
Mga bakuna mga galing mga previous lecturer natin
Dayarin kay iba'y asawa, basta gaw na asikir. Basta arawi, sukulan to.
Nagahang yung kon natin, mahina yung kon natin That's why, ni-improve Mr. Norman yung kon natin, Please, kung magbabakuna kayo, wala na. Yan. Ninilbis. Tatamaman.
Nagahang po yung nawala yung
video?
PowerPoint.
Yan. PowerPoint. Alisin muna natin. Narasan lang muray. Good. We just stand by.
So while waiting for Doc Bano, we would like to acknowledge all our YouTube channel participants. A while ago, it was 385 viewing. Now it goes down to 324. So I guess sa mga nawala, na-disconnect, please watch our YouTube channel at SDO SCC. PTV YouTube channel.
Ayun.
Okay po.
Wala. Ano na lang natin? Isipan na lang natin.
Yes, Doc.
Meron na?
Ino-open.
Please still stand by. Malapit na po ito. Alam po natin na lahat po tayo medyo gutom na din, pero it's okay. Okay? Para sa kabutihan din po natin itong ating orientation or webinar. Or if you want, pwede po tayong habang nakikinig, kumain na po tayo.
Mapagal, no? Ha?
Ating pong ipaumanhin at hindi po yata nakikisama ang sa ating opisina. And by the way po, baka po magtaka din po kayo bakit hindi po ako sumusunod sa standard health protocols. I would just like to tell everyone that I'm on a work from home. So mag-isa lang po ako dito ngayon. Wala naman po akong kasama. Kaya hindi po ako nakamask. Wala rin po akong face shield. Okay, so medyo at least malayo po ako sa COVID.
Oo, puro kabundukan yung background mo, ha?
Yes, sir.
Ganda ng view. Ano ka nakapunta dyan?
Mabilis lang, sir.
Mabilis lang.
Yes, sir.
Gusto kong pumasyal dyan.
Sure, sir. Pwede po. Pwede po natin palitan. Hello. Ang inyong background agad-agad. So, again, Doc Banong, are we ready? Miss Mads?
Okay.
Few minutes.
And by the way, after Doc Banong's discussion, please do prepare your questions or inquiries. Kung meron po tayong mga katanungan, please isulat na po natin. Tapos, or chat it now on our chat box. I mean, type it now on our chat box. O di kaya mamaya, hands up, click the hands up button para dire-diretso po ang ating discussion. And again, I hope with the discussion of I think, Miss Mads, are we ready? I can see the screen now.
Lang po sa amin, ma'am. Lang po sa amin.
Okay. So, as discussed kanina po ni Doc Castillo, yung differentiation of COVID-19 vaccines. So, sabi nga po ni Doc, bawal po natin ikumpara kung ano ang mga dapat nating ikumpara ang bawat vaccines kasi iba-iba rin po yung clinical trials na ginawa sa kanila at the different periods din po. Again, sana po yung mga commonly asked questions, especially po sa mga high blood, sana po na take down notes nyo po yung kanyang discussion at least hindi na tayo kabahan. Okay? At least nakatulong na, at least makapag-decide na po kayo na mag-vaccine. Okay po, tapos ang ating vaccination process overview. Sana na take down nyo din po kung paano. And the BILA behavior. Okay, BILA behavior. Yes,
okay
ma'am. Yes, are you ready?
Okay. Nakikita mo? Okay na?
Yes, sir. I can see your slide, sir. Are we ready?
Sige. I'm sorry, medyo may technical lang problem.
It's okay, sir. Talaga pong ganyan minsan.
Actually, itong laptop natin, hindi na COVID.
Ay!
Share ko lang ito, ha? Okay.
Okay, are you ready, sir? So take it away, sir.
Okay. Kaya. Doon na lang sa phone natin. Skipan mo na lang. We will skip this kasi mahina ayun. Okay, there is a minimum health standard protocol adopted by the DepEd Central Office, the Regional, and the School Division Office. This is based on DOH 2020-005. guidelines of the risk-based public health standard of COVID-19 mitigation. Now, next. Ito na lang, kanin ko. Okay, non-pharmaceutical intervention. Okay. I know, bright na kayo dyan eh. You have bright eyes and bright mind. Basahin nyo na lang.
No.
We have to increase physical and mental resilience, reduce transmission, reduce contact, reduce duration of infection. That is our specific measures. Gutom na tayo, ikabilisan natin. School inclusion number 2. Routine and protocols for health and safety. Okay, number 1, general health and safety protocols. We have detection and referral, school activities, okay, and so on. Okay, this is the number 1 we have to follow. Number 1 measure and maintaining the minimum health standard protocol. You have to practice this. Number 1 is physical distancing. Na-mention na nila ito kanina, nila Dr. Romari, at saka si Ma'am Glinda, I think, at least 1 meter apart at all times. Why? Because someone cough, sneeze, siyempre may mukok o matching, napipan nyo to, siyempre droplet spread yung virus on our nose or mouth, ma-infect yung kasama natin na tao. The COVID-19 virus, if the person has the disease, makukontak natin. Number 2, we have to frequently wash our hands. Hugasan palagi ang kamay. Alam niyo yung way of paghugas. Okay? Tinuro sa atin using alcohol base. Yung alcohol natin hindi 40%. I prepared the 70% either isopropyl or ethyl alcohol. 70%, not 40%. Proper hand washing with soap and water. However, if you are allergic to alcohol, kung allergic ka sa alcohol, magsabon ka na lang. Okay? Kung allergic ka na naman sa sabon, may mga sabon naman na sensitive, di ba? For example, yung Dove sensitive, etc. Para hindi ka ma-allergy sa kamay. Okay? Washing your hands with soap and water or using alcohol base kill viruses that may be in your hands. Number 3, yung sinabi ko, sneezing, coughing. Use tissue or elbow. If you don't have handkerchief or tissue, yung elbow mo, i-cover mo sa nose mo or in your mouth para yung droplets hindi ma-spread. Bilisan natin dyan dahil gutom na rin ako. Medyo nahihiwa na ako eh. Observe proper use of face mask at all times. Okay? Itong proper use of face mask. Both nose and mouth must be covered. Aliwan samay at kapaway sulong. Or yung face mask, pag pupunta ako sa market or sa mall, akal sab, walang buklaw. Hindi ganun ang pag-wear ng mask. Okay, we have to wear mask properly. Either yung itong surgical mask or yung cloth mask. And then, I advise you, nakikita ko yung mga kasama natin dito, pag sinuot mo yung face mask mo, huwag mong hawak-hawakan sa labas. Kasi doon yung dumadapoy, mga viruses, bacteria, huwag mong hawakan yung face mask mo ng kamay mo na itaas. Use your mouth or your lips to elevate it. Diba? Be very powerful yung tongue natin or your mouth natin para bumababa yung face mask natin, huwag mong hawakan. Okay? Hawakan mo, pag-aalisin dito sa may garter, sa may side ng ear natin, itapon mo sa proper ring basurahan. And if you are using surgical mask, that is what we call disposable. Huwag natin gamitin yan ng 1 linggo o 1 buwan. Disposable yan eh. 1 araw lang or sometimes magbasa na yan. Even hours only. Itapon na natin. Because droplets spread viruses. Okay? Number respiratory etiquette, number 5 measures is practice proper disposal. Yan yung sinasabi ko, yung pagtapon. Hawakan mo dito sa gilid, itapon mo. Ready ba? Informal respiratory etiquette in the school, okay na yan. Washable. Okay, yan yung hand and soap, sanitizer, alcohol, etc. Number 8 measure, monitoring and replacement. Number 9 measures, okay, ito rin. Alam natin nakapismas tayo. Pumapasok tayo, ano nung hinahawakan natin ang kamay natin because our kamay sometimes is malikot. Kung minsan yung mga kasama natin, you are touching them, kung saan-saan, malikot yung kamay talaga sometimes. So, ensure routine cleaning, disinfection of frequently touched surfaces. Yung object like your table natin, punasan natin ang alcohol, sanitizer, or what? Mga doorknobs. Using yung bleach solution, o kung walang alcohol, yung sunrocks. At least twice a day. Okay, para hindi natin makontak yung virus kasi mag-stay yung viruses dyan ng sometimes ilang hours or day. Measure number 10, you have to check the temperature. That's why we have triads there. Tingnan natin yung temperature natin palagi. Shall conduct rapid health assessment in the classroom. Wala pa yan Okay, implement adjustment in schedule, etc. Hindi masyado yan. Okay, ito, number 15. Limit travel only the most critical or essential. Kung yung paglabas natin ay importante, that is very essential in our life, okay. Pero huwag kang lumabas. We have to limit our travel. Kung hindi importante yung paglabas mo, just stay at home. Okay? Ito disadvantage sa mga ito, yung may mga chicks dyan dahil hindi sila makalabas, I'm sorry. So, yung mga mass gathering, yung mga gatherings dyan, mga maraming tao, we have to avoid. Alternate recording, okay? Sit flexible, mga dining. Yung dining daw, number 1, pagkakain tayo, supposed to be, wag kumpog-kumpog. Dapat may distansya rin. Huwag tayong mag-share muna ng pagkain dyan. Guideline, healthy foods, hindi pa yan. Enforce the ban in smoking and vaping. Alam na natin yan. Ensure proper ventilation. Dinis kasi ni Dr. Romarito. Maintain proper sanitation and hygiene facilities. We have dapat in school or in offices, we have the foot bath in all entrance. Yung toilets natin, adequate soap with water. Mayroon tayo sa harap ng school. We should have a hand washing station or facility. That's why dito papasok yung winds. Yun. We have tissue paper, trash bin, adequate water, hand sanitizer. So this time of pandemic, medyo magastos siya. Kasi kailangan mo sabon, kailangan mo yun kasi medyo magastos. Alcohol. Measure number 25. Okay, yung visitors natin, you have to limit. Ensure set-up materials, ICT, infrastructure. Okay, ito, hindi masyado yan. Baka na kayo dyan, basahin nyo na, mental health and social support. This is very important because during this time of pandemic, maraming tao na nadidepress. Kasi makapabor yung na sa bahay. Very, nabuboring ka, so maraming nagkakasubject to depression. That's why we need here Madam Madeline for psychological counseling. Measure number 32, learners, physical, okay? Sa'yo lahat, antayo ng basa mo, very bright kayo. Okay. Symptoms, mga symptoms, subjected testing protocol, yan. Remember, apat lang dyan yung importante. Sa minimum standard. Number 1, you have to wear, paglalabas ka, you have to wear always your face mask. Either cloth or disposable face mask. We have to wear also your face shield. Observe proper distancing. At least 1 meter. And then limit your travel. Huwag kang lalabas kung hindi kinakailangan. And then you have to wash your hands always with alcohol or soap and water. Yun lang, apat lang yung pinaka-importante doon sa slides na pinakita ko na 38, I think. So, yun all. Thank you for listening and not for listening. Remember this, sabi ni Charles Darwin, the best scientist, this time of pandemic, hindi pumipili ng race, age, or mayaman, or mahirap itong coronavirus. Kahit sino tatamaan. Okay? It is not the strongest of the species that survive, nor the most intelligent, but the one most responsive to change. Kung sino yung madaling mag-adapt, adaptable to changes, yun ang mabubuhay. That is the survival of the fittest, especially this pandemic. Okay, so that's all. Kasi gutom na tayo. Alam ko, mangkurang limang gil di tanay.
Hindi na, sir.
Ay, yung pasay natin. Hindi na. Ha? Lahat tayo gutom na eh. So, thank you very much. Sa mga Is Good Family, headed by Sir Amor, Gloria.
All right, thank you so much to our Medical Officer 3, Dr. Bana Benitez Jr., for discussing the general health and safety protocols. We have at least around 30 measures to comply with. Pero, sabi nga po ng ating medical officer, ang pinaka-importante po dito is 4. Always wear your face mask, wear your face shields, observe proper distancing, and always wash your hands.
Wash your hands.
Okay, so yan po ang initerate ng ating medical officer na si Dr. Bana Benitez Jr. Again, Doc, thank you so much for that. We move forward kasi para hindi naman po tayo gutumin lahat. Doc Castillo, our Donita Rose doctor, is already with us. So we open for the forum session. Any questions po? While waiting for the questions, your inquiries, your hands up, click button. Okay, we have a question here. I think Ma'am Glenda just click the hands up button. Ma'am Glenda, if you're online.
Yeah, I'm on.
Yeah, there you go.
Can you hear me, Miss Gail?
Yes, ma'am. You may take the floor, ma'am.
Okay. I just would like to ask Dr. Romarie Joy about her opinion on this, because I am taking telmisartan, antihypertensive medicine with angiotenic 2 receptor antagonist. It's actually a vasodilator, right? And apart from that, I have other comorbidities, ma'am. Would you advise me to have Sinovac as a vaccine or the AstraZeneca?
Hello po. Can you hear me, ma'am?
Yes,
po. Yan po. Okay lang po yun kung ano po yung gusto niyo, Sinovac or AstraZeneca, it doesn't matter po. Kasi po yung contraindication naman po, may absolute contraindication po tayo, meron po tayong relative contraindication. Ang absolute contraindication lang po natin is pag nagkaroon po tayo ng allergic reaction dun sa vaccine. Regarding po sa mga antihypertensive drugs, iti-take po natin yan para maintenance po para bago tayo magpabakuna, para normalize po yung BP natin. So, wala po sa ibang research or mga articles na contraindicated po yung telmisartan sa pagbabakuna, either Sinovac or ng AstraZeneca. So, okay lang po kung ano po yung preference niyo po.
For allergies, ma'am, could food allergies be a consideration pag magpapabakuna din po? Say you have an allergy to shrimp, seafoods, that is.
Yes, precaution lang po yun. Kaya po may health screening po tayo dun sa before tayo magbakuna. Yung po sa sinabi ko kanina, yung pwede po magpabakuna kahit may allergy ka. Pero pag once nagpabakuna ka na, yung after ng first dose mo, grabe po yung effect mo sa iyo, yung may severe allergic reaction po, doon na po tayo titigil dun sa bakuna. Regarding din po, so magkakaiba po kasi yan. Yung sa food allergy, okay lang po. okay lang po yun. Pero may precautions lang po. Dapat po may nakahanda po tayo na antihistamines after ng bakuna. Meron po sila dun sa LGU po na directly tinuturok, pwede mo din iinumin. Kung sakaling after vaccination, 15 to 30 minutes, nag-develop sa'yo yung symptoms ng allergic reaction. So, okay lang po yun sa mga food allergy. Basta may gamot naman po.
Thank you, ma'am. Thank you for enlightening me. Thank you and good day po.
Thank you, Ma'am Glenda. To our participants, any questions? You may open your mic kung meron po tayong katanungan or please click the hands up button para po ma-acknowledge po tayo. Anyone from the group? Yes, Sir Raul Bautista.
Ma'am, good morning po.
Morning, sir.
Tagal ko po hindi naka-join, nagka-problema kasi yung cellphone ko pa. Meron lang po akong katanong kay Madam Rosemary Joy Salvador na po. Si Mrs. po is also a teacher. Bali na-operan po siya sa thyroid po. Ibig sabihin po, wala na po siya thyroid and then meron po siyang maintenance. Nagmi-maintenance po siya. Pwede po siya na magpabakuna since meron po siyang yung maintenance po sa thyroid.
Yung sa thyroid po, doon po sa lecture ko, wala naman po nabanggit sa thyroid. Ang may bibigyan lang po ng medical certificate or clearance po yung mga nagtitake po ng immunosuppressive drugs po. So sa thyroid po, ang binibigay po doon, hindi po siya yung immunosuppressive drugs or hindi po siya yung nakapagpababa ng immune system. Kaya okay lang po magpabakuna. Ang sa thyroid, binibigyan tayo ng supplements kasi diba tinanggal na po yung thyroid, tama ba?
Yes po.
Oo. Ang binibigay po sa atin sa may mga thyroid disorder is yung para siyang yung gamot para ma-replace yung mga sa diba yung thyroid for metabolism. Yung supplements lang po yon para po mag-normalize din po yung function ng thyroid dahil wala na tayong thyroid. So sa pagbabakuna, hindi naman po yun nakalagay dun sa as contraindication din po yung mga nagtitake ng thyroid drugs po. Yung sinasabi ko po, ang drugs lang na hindi pwede, yung mga immunosuppressive drugs, like yung mga may cancer, nagki-chemotherapy, or yung may HIV kasi pinapababa ng immune system. Kaya yun po, kailangan po natin talaga ng ma-clear po doon.
So madam, ibig sabihin po niyan, since nagmi-maintain po si Mrs. ko po, no, sa kanyang thyroid, so okay lang po na mapakuna siya po.
Yes po, importante i-maintain niya lang po yun. Hindi niya po ititigil yun.
Thank you po, ma'am. Thank you po.
Okay, thank you so much, Sir Raul Bautista of Abanon NHS. Any other questions? Kindly click on the hands up button, please.
Hello.
Yes, Sir Bernard Magat. Any questions po?
Follow-up lang po doon sa may allergy po, kahit mayroong allergy at the moment, pwede bang magpabakuna? Kasi yung misis ko rin, who is also a teacher, nagre-recur yung allergy niya sa dust. Pag naano siya ng dust, nagkakaroon siya ng allergic reaction sa mukha, minsan dito sa kamay. Halimbawang mayroon siyang allergy, pwede ba siyang magpabakuna?
Yun nga po sinabi ko kanina, sir, okay lang po. Pero kung magpapabakuna kayo, dapat nag-take na siya ng antihistamines days before siya magpabakuna po. Pwede naman po yun, yung mag-take siya ng cetirizine or araw-araw po ba siyang nag-a-allergy, hindi nawawala kahit mag-take ng medicine?
Po. Kaya lang nag-re-recur rin. Pag naano siya ng dust, ayun, nagkaka-allergy siya. Tulad ngayon, may allergy, balik naman siya ng doktor, pero gagaling, tapos pag bumabalik na naman.
Yes po, ganun po talaga pag may allergy ka, pag hindi mo iniiwasan yung triggering factors like yung dust. Kung uminom ka ng gamot, tapos mamaya magwawalis ka, pupunta ka ulit sa mga may madudumi or yung mga very sensitive tayo, mga pollen or sa labas.
ganun po, magti-trigger ulit yun. Aatakihin ulit ng allergy niya kasi hindi po yun agad mawawala. So, hanggat sa hindi po natin nilalayuan yung mga triggering factors for allergy, hindi mo mawawala yung allergy nyo. So, kailangan po maglinis lagi, iwasan po yung mga yung pinag-allergyhan natin. So, lumayo tayo doon. Dapat yun, before tayo magpabakuna. Pero okay lang po kung may allergy tayo, pwede magpabakuna. May gamot naman po.
Okay po. Salamat.
Yes po. Yan, and right after ng bakuna, pwede naman tayo uminom ng cetirizine pag may reaction or allergy tayong naramdaman. Yun po.
Okay.
All right. Thank you so much, Bernard, for that question. Anyone from the group? So while waiting po, I would just like to inform everyone, sa lahat po ng bagong viewers ng ating SDO SCCP TV YouTube channel, please subscribe to our YouTube channel and hit the bell icon and select all to be notified on the latest happenings here in the Schools Division of Pangasinan. So please, lahat po ng ating bagong viewers sa YouTube channel, please kindly click on the bell icon right now and select all to be notified sa lahat ng mga latest happenings ng SDO SCC. Para hindi po tayo nahuhuli at sabihin natin hindi po natin alam. So please, kindly subscribe to our YouTube channel. So anyone from the group again, meron pa po ba tayong katanungan? Again, we have a hands up button. For what? Hands up from... For a while lang po check ko lang po kung sino yung nag-hands up button. Hindi ko po kasi makita. Oh my gosh, where is... Anyway, kindly turn on your microphone. Doon po sa nag-hands up. May nakikita po kasi ako, hindi ko lang po siya mahanap sa kung sino
GD.
po.
May initial na GD.
Opo, GD. I think, si Ma'am Glenda po ba ito? Or another po?
Oh, baka sila.
Okay. So, anyone from the group again, tanungin na po natin habang nandito po sa atin si Doc Castillo.
Ma'am Gail, pwede ako?
Yes, sir. Sure. Go ahead, Sir Marlion.
Hello, Ma'am Dr. Salvador. Dr. Romary Joy. Good noon po.
Good afternoon po.
Doc, in the event na, say for example, nagpabakuna yung ating guro at nagkaroon po ng adverse effect doon sa kanya at huwag naman sana may nangyari sa guro.
Ano nangyari?
Meron po bang
allergy?
Huwag naman sana may worst case scenario na may nangyari sa kanya na hindi inaasahan. Any support from the Department of Education? Meron po bang precautionary measure na inihanda ang Department of Education Region 1 with regards to the support sa teacher na nagkaroon ng hindi magandang pangyayari? Huwag naman sanang mangyari.
Ano po yung, i-clarify ko lang po anong nangyayari, magkaroon ba ng adverse side effects or
yes,
ano ba?
Tapos dahil high blood siya parang inatake or na-stroke, something like that. Tumaas ang dugo.
Okay.
Opo,
pero hindi naman namatay, parang gano'n. Actually, yung sa mga ganun po, meron po tayo, hindi ko po sure kung dito sa Department of Education meron po. Sa Department of Health po, sa PhilHealth po, may assistance po tayo doon. Covered po yun ng PhilHealth. Kung sakaling after mo magpabakuna, ay nag-react ka doon sa bakuna, yung hospitalization po ay covered po ng PhilHealth po. Mga gastusin doon. Under siya ng AEFI po yung adverse effects yung after magpabakuna po. Pero doon sa Department of Education, yung assistance, financial assistance po ba yung tinatanong nyo? Sir? Financial assistance po ba?
Yes po. Yes po.
Yes, yun po. Hindi, yung sa CO po, wala naman po ako nababalitaan kasi kahit yung mga nagka-COVID passing po, wala din assistance hanggang ngayon po.
Ay, ganun po.
Except lang po yung mga yung mga mortality natin. I think meron po silang binibigay din.
Uy, dapat man ano tayo kumunuluni.
Ay, salamat po. Salamat po, Doc. Thank you.
Okay na po, Sir Marlon?
Yes, Ma'am Gail.
Okay.
Thank you po.
Thank you rin po, sir. Doc Castillo, meron po tayong question. May nag-PM po sa akin from Sir Fortunato de Guzman of Mabalbalino, NHS. Tinatanong po niya, ask ko lang po ma'am kung pwede po magpa-vaccine si Mrs. kasi meron po siya allergic reactions sa mga gamot like pain reliever or any medicine intake. Yun po. Selected lang po yung pwede sa kanya like anti-allergy, Neozep, pero other medicines alanganin po kasi may effect po sa katawan niya. Yun po. Noon po, nag-undergo pa po ng skin test before the use of medicines. Yun po, Doc Castillo, ang inquiry ni Sir Fortunato de Guzman po.
Yung with regards to allergic reaction po ng vaccination, wala po tayong skin test doon. Unlike doon sa mga binibigay nating antibiotic, hindi po natin ni-skin test yung sa vaccination, diretso po siyang tuturukan. So yun gaya ng sinabi ko kanina, once na nag-react yan, ready po yung LGU natin. May mga emergency drugs silang binibigay. So, paano natin malalaman kung may reaction yung katawan, yung mag-allergy sa Sinovac? Hindi po natin, wala pa pong studies about doon. Kasi syempre, iba-iba po yung reaction ng tao. Although may mga pangyayari na after bakunahan, grabe yung pantal na nararamdaman nila, yun po yung mga yung super severe, yun po yung mga sinusugod sa hospital. Yun po, pag nakaramdam ka ng paninikit ng dibdib, yung hindi ka makahinga, tapos may mga pantal-pantal, yun po, automatic yun ang gagawin nila, papainumin ka nila ng para sa allergy, yung mga antihistamine, kung severe, pwede ka nilang i-admit, ganun po yung ginagawa natin. So, hindi ko po pwedeng hulaan kung ayan, magpapabakuna siya ng Cyrons, magkakaroon siya ng allergy. So, wala pa pong ganun. Depende po kasi sa tao yun. So, hanggat hindi mo tinatry, hindi mo malalaman kung may allergy ka. Kasi yung sa bakuna, unlike dun sa mga antibiotics, wala talaga siyang skin test po. So, hindi natin malalaman kung may allergy ka ba dito o wala. Kaya nagtitake po tayo ng precautionary measures, kaya may resting time tayo na 15 to 30 minutes bago lumabas yung mga effects ng after mo magpabakuna po. Yun po.
So, sana po, Sir Fortunato de Guzman, sagot po, narinig po natin ang kasagutan ni Doc Castillo. Ayun po. So, anyone pa po who would like to ask question?
Ako po, ma'am.
Yes, sure, ma'am. You may ask your question po.
Good day po sa lahat. Good day po, Dr. Salvador. Itatanong ko po, kasi yung mother ko, ano na po sila, senior citizen. Ngayon po, marami pong tumubo sa kanila na yung pigsa. Opo. Ngayon, masakit daw, kaya nagtitake po sila ng gamot para sa pain, tsaka may antibiotic na din ata kasi talagang masakit daw po. Pwede po ba na just in case, halimbawa, next week, may schedule sila na ma-vaccinate? Ano po, pwede po ba na ituloy po nila o re-schedule po sila? Kasi po, umiinom po sila ng gamot ngayon para po doon sa pain dulot ng pigsa.
Yes po, for rescheduling sila, tapos kailangan po kasi di ba bedridden po ba sila, tama? Yun po. Yung mga bedridden, yung mga hindi po masyadong magagalaw, nasa bahay lang, nakahiga ng mga matatanda.
Hindi naman po. Active naman po sila, kaya lang may diabetes po sila.
Ayun po.
Saka may nung anong taon yun, mga 20 years ago, meron po silang enlargement of the heart.
Okay. Okay lang po magpabakuna, pero ang advice ko, tapusin muna yung regimen niya ng antibiotic. Tapos, sabi nga, di ba, parang pagpapababa ng BP, dapat naka-maintain yan. Before ka magpabakuna, dapat yung pangatawan mo, yung normalize lahat po. So, kung may mga pigsa-pigsa siya, mas maganda sana siguro kung tapusin muna natin, tapos mawala muna yung mga pigsa niya. Tsaka hindi po naman kayo nagmamadali, di ba po? Mas maganda po, stay home muna. Kasi mababakunahan po ang lola nyo, tama ba?
Mother ko po.
Ay, mother nyo po, sorry. Yun po, yung mother nyo po, yun po. Dahil nasa bahay lang naman siya, ma'am, di ba?
Opo.
Okay lang po yun. Hindi naman po tayo nagmamadali magbakunahan yung mga matatanda. Although yung mga matatandang normal, hindi ko naman sabi abnormal, yung mga stable yung condition nila, yung walang sakit, normal ang BP, yun po, pwede sila magbabakuna. Pero yung case ng mother nyo, okay lang naman po i-reschedule natin. Pwede naman tayo makiusap sa LGU natin. Hindi naman po sila tatanggi. Since nag-antibiotic din kasi yung nyo po, yung mother nyo. 7 days po ba yung antibiotic? Tama? Yun po. So, 1 week lang naman po. Pag nawala yun, okay na nun po. Tsaka ang importante ngayon, stay home muna para sa mga matatanda. Yun lang po.
Doktora, maraming salamat po.
Thank you, Ma'am Jeannie Verceles, our school head from Cobol, NHS. Tama po ba, ma'am? Cobol po ba? Baka magkamali na naman ako.
Opo, tama po.
Okay, thank you so much, ma'am. Okay, Doc Castillo, sana hindi pa po kayo gutom. Meron po ulit tayong questions dito. Actually, isa pa na po. Magandang araw po. Pwede po ba ako magpa-vaccine kung may allergy po ako sa aspirin? Ayan po, ma'am.
Okay lang po. Ay, yung yung allergy sa aspirin, pero hindi siya nagdetect ng aspirin, right?
Saglit lang, ma'am.
Ano kasi yan?
Yes, wala pa po siyang reply, ma'am.
So,
Arenas Diaz-Abalos, kung narinig niyo man po yung question ni Doc Castillo, nagtatanong po siya.
So,
okay.
Ito, yung tanong ni ma'am kung pwede siya magpabakuna kahit may allergies sa aspirin.
Yes, ma'am.
So, okay lang po. Yung sinabi ko kanina, meron tayong naka-ready na antihistamine for allergy po dun sa sa LGU site natin kung saan tayo magpapabakuna. Pero yung mga taong umiinom po ng aspirin, kailangan po sila ng clearance. Kasi syempre, di ba, yung aspirin po siya is blood thinners. May mga cases po tayo ng mga effects ng mga vaccine. Yung mga clotting disorders, yung clotting, mga nagtitake ng blood thinners, yun po yung kailangan ng medical clearance po. Kasi i-screen yun lahat eh. Titignan kung normal ba yung, i-screen mo na laboratory niya. Kung okay ba, nababakunahan siya, yun po. Pero dun kay ma'am, I think ang tanong lang naman niya is yung allergy sa aspirin. Hindi siya nagtitake. So, okay lang po yung sa aspirin. Okay lang.
Okay, thank you, Doc Castillo. I hope, Ma'am May Arenas Diaz-Abalos, narinig niyo po ang kasagutan ni Doc Castillo. So, Sir Norman, just click the hands up button. Yes, Sir Norman, any questions po? Nag-hands up.
Nagtatype pa lang ako ng question ko. Pasensya na. Good nun na, no, Doktora?
Yes.
Doktora, may tanong po ako kasi ako ay na-COVID po ako last January. Ngayon, diabetic din rin po ako. At ang tanong ko po kung ano po ang magandang bakuna para po sa akin. Kasi ang sabi nung isang news ay kahit pwede, kahit any brand ay hindi nasasabihin kung itatarak na rin dun sa okay lang po ba yun, Dok, kahit ng vaccine ang pwedeng gamitin?
Actually, dati, yung mga nagka-COVID, di ba nag-aantay pa sila ng 90 days bago sila magpabakuna. Ngayon po,
Yes.
iba na po. Kahit after mong magkaroon ng COVID, recovered ka na, yun po, pwede na ka na agad mabakunahan. Tapos po, kung may comorbidities ka like diabetes, any vaccines will do. Kaya wala po tayong pinapanigan na vaccines kasi iba-iba pa naman po yun. Na-test po yung mga vaccines according to age, yung mga may people with comorbids. Yun po yung result ng kung makikita niyo yung efficacy rate po, andun po lahat yun. So choice niyo po yun kung ano ang gusto nyong ipabakuna. Kung yung Sinovac, actually may mga nakikita ako less lang yung nararamdaman nilang side effect. Yun po based on experience to yung Sinovac po. Pag nagpaturo ka nun, actually, yung mga nakoconsolidate kong cases dito sa DepEd R1, mga nararamdaman nilang side effect, more on sa AstraZeneca, mas matindi po yung nararamdaman nila sa side effect. Though, hindi po natin pwede siya ipag-compare na dalawa. Pero regarding dun sa efficacy ng Sinovac, kahit wala kang nararamdaman, tataas pa rin yung antibodies mo. So, dun po sa case to comorbids, okay lang kahit ano po yung piliin nyo po. Po.
Okay. Buti na lang, doktora, hindi ako allergic.
Okay lang.
Wala akong allergy. Oo,
okay lang po. Wala
allergy.
Problema dun sa may allergy. Wag lang severe allergic reaction.
Severe allergic reaction.
Kung nagkaroon
Thank you po, doktora.
kung severe, yung sa mga nagtatanong, daming tanong sa severe allergic reaction, malalaman mo lang na may allergy ka dun after mo magpabakuna. Kasi hindi natin pwedeng hulaan eh. So kaya nga tayo may mga gamot doon para in case na may mga nag-react doon sa vaccine, maturukan agad or mapainom agad ng gamot. At tapos, hindi na po sila magsa-second dose nung vaccine na yon kasi nagkaroon sila ng severe allergic reaction. Ganun po yung nangyayari ngayon. Oo, para hindi na maulit. Yun po.
Doktora, isa pang tanong ko, doktora, kasi nagpa-flu vaccine ako itong month na to. Okay lang po ba yung pag dumating next month yung vaccine, okay lang po ba na magpa-vaccine?
Nagpa-vaccine po kayo ngayong week?
Ito, last week po, ng flu vaccine.
Ay, okay lang po. Walang problema. Kailan po kayong papabakuna?
Okay.
Next month?
Hindi ko alam kung kailan darating po yung sa mga okay lang po ba yun?
Yes po, yes po.
Okay po, doktora. Thank you. God bless po.
Thank you.
Miguel, ano kayo?
Naka-off po, Miguel. Naka-off mic, Miguel.
Naka-mute po.
Sorry. Doc, meron po tayong mga questions sa ating YouTube channel. Medyo malayo po kasi yung aking isang gadget. Lalakasan ko na lang po para sana marinig nyo po. Okay po? Saglit lang, Doc.
Sige po.
Doc Castillo, may question po tayo coming from Sir Marlon Marchan. Tanong ko lang po, pwede po ba ang COVID vaccine sa mga cancer of benign? Yan po. Salamat po from Mabalbalino NHS.
Cancer of benign?
Opo.
Cancer of benign? Benign?
Yes, ma'am.
Benign
yes,
cancer?
Yes, Doc.
Nagpapa-chemotherapy ba yan? Ano yung mga iniinom niyang drugs? Kung umiinom siya ng mga immunosuppressive, ganon. Kasi diba sa cancer, yung chemotherapy nakakapagbaba ng immune system. Yun. Ay, hello? Tama ba? Yun po, yung kailangan po sila ng clearance dun sa upon vaccination or pwedeng i-reschedule muna sila. Titingnan mo kasi, i-assess muna yung tao kung normal ba lahat ng parameters niya, pwedeng blood parameters, pwedeng yung vital signs. So, depende po sa assessment. Ipapakita po sa doktor yon bago bakunahan. So, ngayon, hindi ko po nakikita yung pasyente. Hindi ko alam yung appearance niya, yung lagay ng kondisyon niya, kung kahit benign ba, o okay ba, malakas ba siya, or kakatapos lang ng chemotherapy niya, ano yung mga ginagamot na binigay sa kanya. Tatanungin lahat yun sa screening bago magbakuna.
Okay, I hope Sir Marlon Marchan na rinig niyo po ang kasagutan ni Doc Castillo. Next, ma'am, from Miss Rosalia Chua from Libas Elementary School. Pwede po ba ako magpa-vaccine? Nagtitake po ako ng citicoline po ba? Tama? I hope I got it right. And clopidogrel and TMZ at iba pang para sa BP. Yan po, Doc.
Okay po, yung gamot nyo po for yung citicoline, it's actually papaganda yun para sa memory yun ng citicoline para maganda yung brain function natin, lalo na sa mga matatanda. So sa citicoline wala pong problema. Pwede magpabakuna. Pati yun sa mga antihypertensive drugs, pwede po yun. Ang problema natin yung sa clopidogrel. Kasi yung clopidogrel po, isa rin po sa mga blood thinner, parang aspirin din yun. Kaya kailangan din natin pwede natin ipalaboratory yung yung blood parameters niya. Kasi nagtitake po siya ng clopidogrel. Pag nagtitake ka ng clopidogrel kasi yung pampalasaw ng dugo. Kasi kung for example na heart attack ka, binibigyan ka ng maintenance ng clopidogrel. So magpe-precaution po tayo sa pagbibigay ng bakuna sa mga ganun cases. Especially may mga bakuna kasi na after mo iturok, yun, may mga dinudugo or nagba-blood clot. Kaya depende pa rin po kung anong resulta ng mga blood parameters at kung ano ang assessment after ng check-up po. Yun.
Okay. Thank you so
Hello, Ma'am Dor.
Yes.
Pwede magtanong?
Sure, ma'am. Marites, go ahead po.
Hello, Doktora.
Hi.
I just want to ask kung pwede akong magpabakuna. Naoperahan po ako 3 years ago sa brain aneurysm. Wala po akong maintenance.
Okay ba yung vital signs nyo ngayon? I mean, BP nyo, ganon? Okay lang ba? Normal
okay
po ba? Ilan po ang BP nyo ngayon? Kung normal, okay lang po.
Normal, hindi naman po ako hypertensive, Doktora. Wala po akong, nagre-range po ako ng 120/80. Ang pinakamataas po yung 130/80.
Kasi yung case nyo, nagpa-opera kayo sa brain aneurysm, actually yung mga clinical trial, wala pa pong ngayon na balitaan na ginawa po sa mga taong after surgery ng ganyang cases po. So, tayo ngayon, dahil pandemic po, inaaprubahan po sa lahat ng cases except yung mga absolute contraindication. So, yung sa inyo, dahil medyo matagal ng 3 years, I think okay naman po na magpabakuna. As long as okay yung BP nyo, yung ibang vital signs nyo, normal lahat, at healthy po kayo, yun po, okay lang po yun.
Okay, thank you so much, Doktora.
Thank you, Ma'am Marites. All right, for our last question, Doc Castillo from... nag-hands up po si...
Nakataas si Sir Joel.
Sir Joel Basto.
Opo, narinig po pa ako.
Yes, sir. Loud and clear po. Go ahead.
Po, stroke patient po ako noong 2018.
Yes po.
Meron po akong maintenance. Pero nasabi nyo, kailangan ng clearance ng doktor. Kasi nagtitik po ako ng apixaban.
Apo.
Para sa blood thinner po.
Apo. Kailangan po din ng clearance ng doctor yun.
Pero willing po magpa-vaccinate.
Yes po. May sa LGU may checklist po na ilalagay doon. I-interviewin kayo.
Po, yung blood pressure ko okay naman, normal siya.
Ayun po. Actually, yung sa mga cases na ganyan, mga nagtitake, hindi ko nasama sa presentation kanina, kailangan po talagang i-clear po yan. Titingnan po yung mga blood parameters, kukunin yung dugo nyo, kung okay ba yung bleeding time nyo, clotting time. Kasi di ba may history po kayo ng stroke, tama
blood clot, opo.
Kaya kailangan po natin i-test yan. Kaya pag nagpa-screen po tayo, dapat sabihin natin lahat ng history natin.
Opo.
So kung normal naman po lahat ng parameters nyo ngayon, okay, cholesterol, yung blood clotting factors nyo. Kasi yun. Kasi kung mataas yung blood clot, mabilis yung sa dugo nyo kung tinest nila. Kung mataas yung clotting factors nyo, mabilis talaga kayong magka-clot.
Opo.
Kasi may mga reported case din naman nagka-clot, diba? Yung clotting factors affected din po pag nagpa-vaccine ka. So, kailangan natin makita yun. Kung
Opo.
normal ba o hindi. Yun po.
So, thank you po.
Opo. Dapat maging honest po tayo sa mga history natin kasi para ma-assess tayo ng mabuti. Ayun lang.
Thank you po, Doktora.
Thank you, Doc. Sir Joel, palakas po tayo para
Yes, ma'am.
ma-vaccinated po tayo. Okay po?
Opo.
Okay. Sir Norman, any questions po? Naka-hands up button po tayo. May karagdagan na katanungan pa po, Sir Norman? Or naghang na po ata si Sir Norman? Okay.
Naghang lang ata yung aking ano.
Okay. Okay. Thank you, Sir Norman. Doc Castillo.
Thank you, Ma'am Gail.
Yes, sir. Last question po from Ma'am Raquel Rosal. Okay. What if, ma'am, before vaccination ay okay ang BP?
Yes.
Pero nung time na nakasalang na for vaccine, ay biglang nag-escalate ang BP. Itutuloy pa po ba ang pagpapabakuna? Yun po, Doc. From Ma'am Raquel Rosal.
Well, depende po sa BP nyo yan. Ang actually, hindi po nila binabakunahan yung may BP na 180/120. So, kung sakaling ang unang BP nyo is 30 minutes before kayo magpabakuna is 140/90. Tapos, biglang naging 180/120. Hindi po nila kayo babakunahan. Pero may mga cases po tayo na kahit 140/90 yung blood pressure nyo, minsan 150/90, okay lang po. Basta hindi po siya lalagpas ng 180/120. Yun po yung limit po bago bakunahan. Yun lang po. Tsaka kung hindi po napababa yung BP nyo, naabot nyo yung limit, i-reschedule po kayo. May rescheduling po para sa mga ganun kataas na BP. Po. Yan po.
Okay, I hope Ma'am Rosal, Ma'am
Gail. Ma'am Gail,
Yes.
may tanong lang ako last lang.
Okay.
Ilang buwan ang effectiveness po nung vaccine, Doktora?
Yung vaccines po ngayon wala pang study. Actually nabasa ko yan. Lahat po ng vaccines natin ngayon kasi ano siya, emergency use. Last year lang po siya na-develop. Kaya yung effectiveness niya, kasi mag-1 year pa lang, hindi pa po nila naaral kung gaano ba katagal, gaano ba siya katagal. Kasi yung effectiveness po na may measure po natin siya ng ilang months, years po siya masasabi bago mag-effective. Actually, yung FDA natin, actually yung mga bakuna, hindi po siya totally approved. Pag sinabing approve yung effectiveness, iba po kasing efficacy at effectiveness natin. Po, yung pinemeasure natin ngayon is yung efficacy, not the effectiveness. So, regarding yung kung gaano katagal tayong proprotektahan, wala pa po tayong wala pa tayong written or studies about dyan. Ang importante po mabakunahan tayo kasi para may protection din. Yun lang po, hindi po natin masasabi kung gaano katagal. Opo.
Opo, Doktora.
Kaya importante po talaga na yung minimum health protocol po i-maintain lang natin yon kasi hindi pa natin sure kung gaano katagal ang provided ng protection kung gaano yung mga vaccines natin ngayon. Yun po.
So, Doktora, kahit na-vaccine ka na, mag-face shield pa rin, mag-face mask pa rin, continuous pa rin.
Yes po. Yun nga lang, may cases tayo sa US na after vaccination second dose, di na po sila nagmamask. Huwag po natin silang gayahin.
Oo nga po eh. Kasi yun ang iniisip ng iba eh. Iniisip na iba, pag na-vaccine ka na, pwede mo nang tanggalin lahat yung face shield, face mask, magsi-celebrate na kayo, magkakaroon na kayo ng gatherings. Yun ang nangyayari.
Kasi yung ibang, 'di ba, yung ibang vaccines natin, aside from the COVID vaccine, yung mga years po ang inaabot niya bago natin masabing effective 'yan. Eh yung COVID vaccine last year lang po nagawa. So hindi po natin pwedeng sabihin na effective and very yung protection niya matagal. Kasi wala pa tayong mga ilang taon, mga lang 5 years, 10 years, yun po. Hindi pa natin alam yung mangyayari. Yun po.
Thank you, Dr. Gail. Thank you ulit.
Okay, thank you, sir. So I guess, Doc, we shall end this open forum for Sean. I hope hindi po kayo nagutom sa amin, Doc.
Ay, hindi, okay lang. Internet.
Yes. Thank you so much po for the patience. Tapos maraming salamat po sa grant ng invitasyon namin sa inyo. Anyway po, sa ating mga participants, kung meron pa po tayong mga questions, i-post nyo lang po sa ating YouTube or sa ating chat. Then we'll get into contact with Doc Castillo kung okay lang po sa inyo, ma'am. I-PM po namin yung questions nila and then hopefully ma-PM nyo rin po yung answer sa amin para mabalikan din po natin yung ating mga participants. Okay lang po ba yun?
Yes, okay lang po.
Yes, thank you so much. So again, thank you so much. Yes, sir.
Again, I would like to thank Dr. Romary. We will also acknowledge the parents of Dr. Romary. Mr. Roland Salvador, principal of Bulingit National High School, and Ate Mabel Maribel Salvador, the head teacher of Bulingit Elementary School. Ayun. Congratulations, Sir Roland and Ma'am Maribel. Alam ko nakikinig sila for raising a very beautiful and intelligent daughter in the person of Romary. Ayun. Sige po. Thank you so much, Doktora.
Okay, thank you, Doc Castillo, and again,
for the invitation.
Okay, so that ends our VACC 2 school vaccination program campaign or webinar. Before I end, thank you for our tech team members for today's event. That would be Sir Roldan Eden, our SMME EPS 2, Sir Dexter Di Guzman of Tamayo NHS, and Sir Jeric Tagulao of Libas NHS. Sana po wag po kayong magsawang i-assist kami technically. Okay po? So maraming salamat po. Before that po, syempre hindi po ito mawawala. This is evidence-based po ito. Doc Castillo, you may want to join us. We will be having our photo op. So lahat po, please, I'm requesting everyone to please turn on your camera po for our photo op. You may join us. There you go po. Ano po ba? Please, everyone, paki-turn on po ang inyong camera for our photo op.
Basta picture mo. Cellphone mo tayo, pasak irara may picture.
Thank you very much.
There you go. So, okay. 1, 2, 3, say cheese. Okay po. 1, 2, 3. Okay po, saglit lang. Ano ba?
Yung sign ng pag-vaccine.
Yes, we can do the sign of vaccination. Yung sa gilid po with the hashtag. Ganyan po. Yes. Saglit. Okay, there you go. Another one, please. 1, 2, 3. Say cheese and the hashtag vaccination po. Another one po. Smile din po. 1, 2, 3. Okay, isa po po. 1, 2, 3. Okay, there you have it. Thank you so much po sa lahat ng ating participants. Maraming salamat po again to all the DepEd Sangkarisi top management. Maraming salamat po to Doc Castillo. Maraming salamat po.
Thank you, Doctor.
School heads, teaching, non-teaching, SDO, lahat po. Maraming salamat. And sino pa po? Our tech team again, Sir Roldan, Sir Dexter,
Thank you sa ating
Ma'am
Marie Choi, Ma'am Jane. Thank you.
Happy lunch po.
Thank you, everyone.
Salamat, Doktora.
Yes, happy lunch po. Everyone, please keep safe. Yung mga reminders ko, the beta behavior, yung ating for the measurement, wear your mask, your face shield, a proper distancing, at saka yung ating